Good afternoon. Welcome, everyone, to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang. Here. Senator Wynn. Here. Senator Titus. Here. Senator Stone. Chair Donate.
And I am here. Everyone's present. Madam Secretary, please indicate that all committee members are present. Good afternoon, everyone, and welcome to today's Senate Committee on Health and Human Services. We have a very packed room, which doesn't really happen in Senate HHS. We do also have an overflow room for folks that aren't able to check into this room. So just wanted to give the full overview. Today we have three bills, Senate Bill 237, 297, and 242. So that is the order that we're going to start off with. Senate Bill 242 will go last. So just wanted to give everyone a clear understanding. Before we start, I do have a few housekeeping announcements. So as a result, agenda items can be taken out in a different order than listed. And we know that today folks will want to provide their public comments. So we ask that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated to ensure we can get through the agenda items in a timely fashion. Speakers are encouraged to avoid repetition of comments made by previous speakers. We want to encourage as many folks to speak on all three bills, and so it's okay to say ditto. It's okay to wrap your comments short, provide written testimony to our staff. That way, folks have the opportunity to also speak on the bills present and forward. As I mentioned, you can also submit your public comments in writing in addition to testifying or in lieu of thereof. If you wish to testify, you can sign in at the table by the door and provide a business card to the committee secretary. The chair, which is myself, or a member of the committee may request testifiers to submit documentation supporting their testimony. And then when testifying, please turn your microphones on to speak and off to listen. And a reminder to all those who testify, pursuant to NRS 218E, it is unlawful for a person to knowingly misrepresent facts when testifying before a legislative committee, and the person who knowingly does so is guilty of a misdemeanor. Anyone who wishes to receive the copies of the committee's exhibits should go to the Nellis website. And finally, we ask that everyone to please turn off your electronic devices. We'll start off with opening the hearing on Senate Bill 237. So I'll go ahead and open up the hearing. This bill revises provisions relating to crisis intervention, and today we welcome Senator Harris to present on this bill. So welcome to Senate HHS, and please proceed when you're ready.
Good afternoon, Chair Donate and members of Senate HHS. My name is Dallas Harris. I represent District 11 in the southwest part of Clark County, and it's my pleasure to present Senate Bill 237 to you today. Thank you for taking the time to hear it. Clearly, funding the Crisis Intervention Center is so important that we've got a packed room. So thank you all. I expect support from all people in the seats. Joking aside, this bill is, dare I say, a cleanup bill from last session, working on a bill that was shepherded by our former colleague, Senator Ratty, and the Health and Human Services Committee last session to set up our state's 988 program. The Board of Health was responsible for promulgating regulations around what access lines these fees would apply to. There was quite a bit of discussion during the regulation process, and at the end, I believe there was some consensus that we weren't quite there on the definitions that we needed. And so we have brought a bill to codify the definitions for what will apply. We've codified the rate, which will be 35 cents. We need to get this going. We need to start collecting these dollars so that we can get this program set up. We have the support of the telecommunications companies, but we needed to make sure that we got it right, and so that those actors who may not be so willing don't have some out to not participate, and the program isn't funded in the way that we'd like it to. Committee members, there is an amendment that I submitted this morning, and I hope everyone has it because it makes quite a few changes, and so I'm going to be operating off of that version of the bill as I walk through it. The state board will impose a surcharge of 35 cents. Then you'll see here in section 1 what lines that would apply to. Section 2 makes it so that these taxes are going to be kind of assessed and imposed at a rate that other taxes are imposed. You will collect the money in one particular month and then remit the money to the board before the end of the subsequent month. We also put in a provision that requires companies and providers to report to the division the average number of lines that they anticipate this being subject to, and then the board has an option to adjust the rate according to inflation. If they do so choose to do that, it would only be every 5 years so that the rate's not constantly changing on folks. But we do want to make sure that the funding source, because this is the funding source for the 988 line, remains sufficient to do the job that it's designed to do. Again, these are permissive regulations, not mandatory, and I imagine the board and the companies that are subject to this would be working on that in the future if necessary. And then the last piece here just tightens up those definitions that I mentioned in the beginning, to make sure that we're really capturing the folks that we intended to catch and that the federal government has suggested should be subject to this surcharge. With that, Chair Dunyate, I make myself available for questions if committee members have any. I also believe we have Ms. Finney in the back from the Department of Public Behavioral Health, who administers this program, to answer any questions that are out of my depth. Thank you.
Thank you so much, Senator Harris. Questions from committee members. Senator Titus.
So thank you, Mr. Chair, for the question, and thank you for bringing a bill that adds some clarity. It's my understanding the original version of the bill used language, it was up to 35 cents, and the decision was to go for that maximum amount. Can you explain why? Do you know why that happened?
So I was not a participant in the regulatory process by which the regulations were promulgated by the board, but that was a discussion that happened between the board and the stakeholders to come to the 35 cents. I will note that that was the full 233B process by which there was notice and opportunity to comment. And I believe it was a determination based upon approximation of how many lines this might touch and what kind of funding that the board thought they would need in order to really get this thing going.
Great, thank you. Another question, Mr. Chair? This might be for legal if they're on board or staff. Originally, it's my belief that the bill was a 2/3 bill because it imposed a new fee. This bill is not a 2/3 bill. Is that because the fee has already been established and this is now clarifying language on who is charged?
That is my understanding. Senator Harris, you can also respond to that, but if you need more clarification, we can have legal chime in. So.
Dallas Harris for the record, Senator Titus. That would be my best guess, but who knows how that 2/3 thing works anyway.
Right, thank you. Because it's important to establish that that is why there's not a 2/3 on this, because again, it is a fee, but I think it's not changing the fee, so it's already established. So maybe if they could just clarify that at some point, it would be helpful.
Yep.
I mean, thank you.
We will have the committee counsel.
And
refer it, so.
I do appreciate you bringing this bill forward because the 988 line is critical to stand up. We did not see the concerns and who would pay, and so far from what we have been hearing, it hasn't been implemented the way it should have been because of this. So if nothing else, it does bring some clarity. So thank you.
Thank you so much, Senator Titus. Any other questions? Nope. Okay, we'll go ahead and move on to testimony and support. So we're going to start with testimony and support of this bill. So anyone that would like to please come forward, of course, limit your comments to 2 minutes each. And we'll start here in Carson City and then move our way to Las Vegas and virtual. So please proceed when you're ready.
Thank you, Chair and members of the committee, and Senator Harris for bringing this bill. Leah Case, Leacase, here today on behalf of NAMI, the National Alliance on Mental Illness Nevada chapter, in support of Senate Bill 237. NAMI has worked on the regulatory process since 2021 when the first bill passed for the 988 crisis line. It has been a long, drawn-out process, and we're happy to see some of these clarifications going into state law, and will be participating in continued regulatory processes this interim. Thank you.
Thank you, Chair Donyate and committee members. Misty Grimmer with the Ferraro Group representing Cox Communications. We and our customers are one of the taxpayers in this situation. We are appreciative to Senator Harris for having an open door to hear our concerns with how SB 237 was originally drafted and making the changes that we requested. Most notably, changing the bill to keeping the Department of Health as the home for this fee. Cable and internet companies are not regulated by the Public Utilities Commission in any way, and we wish to remain out of that forum. Even though this body passed the legislation for 988 fee last session under the guidance of Senator Ratty and Senator Kekeffer, and through a temporary regulation, the fee will go into effect and funds will start being collected 7 days from today. SB 237 is still a necessary bill to clarify in statute the definitions of the types of phone lines the fee applies to. As the Senator mentioned, over the course of the regulatory process last year, some confusion did arise about the definitions. Telco law is varied and complicated, so it's never as simple as saying a fee should apply to a phone line. In our testimony last session and still today, as a rule, we believe there should be a direct nexus between the tax collected and the service provided with that revenue. The nexus here is not exactly close, but we recognize that the legislature and the federal government have already established this as a policy. Cox also recognizes that suicide prevention truly is a public health crisis, and sometimes funds simply must be found even if a more closely connected funding source is not available. For those reasons, we encourage the passage of this bill as amended.
Thank you so much. Anyone else in Carson City? Anyone in Las Vegas? And virtually. Oh, looks like we have someone in Las Vegas. Wrong bill. Anyone virtually?
If you would like to testify in support of SB 237, please press star 9 or raise hand within Zoom to take your place in the queue.
Good afternoon, Chair, members of the committee. Fergus Loffridge for the record. That's Fergus, Laughridge, Chair of the Rural Regional Behavioral Health Policy Board. We too like to support this bill as a body, and thank Senator Harris for bringing this forward with the clarifying language as the funds from this go to help with crisis intervention, which is a vast shortage in our rural communities. So we do support this bill. Thank you, sir.
Chair, there are no callers choosing to testify additionally at this time.
Thank you so much. Anyone in opposition in Carson City? In Las Vegas? In virtually?
If you would like to testify in opposition to Senate Bill 237, please press star 9 or raise hand within Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And last but not least, anyone willing to testify in neutral on this bill?
Thank you, Chair. Russell Rowe here on behalf of AT&T. We just wanted to express our gratitude to the bill sponsor for working with us on the amendatory language. Thank you.
Thank you, Mr. Chair. Michael Hillerby on behalf of Charter Communications, and I will echo the comments of my colleague, Mr. Rowe, and thank the sponsor.
Thank you so much. Anyone else for neutral in Las Vegas and virtually?
If you would like to testify in neutral for Senate Bill 237, please press star 9 or raise hand in Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Senator Harris, any closing remarks?
Chair, I just wanted to thank you again for taking the time to hear this bill today and encourage the committee to move as expeditiously as possible so that we can get this fix in place. Thank you all for your time. I guess I must have been mistaken about the support. We'll see what else is on the agenda. Have a good day.
Thank you, Senator Harris. Always a pleasure to see you. We'll go ahead and close the hearing on Senate Bill 237, and we'll move on to Senate Bill 297. So I'll go ahead and open the hearing for this bill. This bill provides for the establishment of the Nevada Memory Network, and we have Mr. Matt Driscoll and a few other folks coming to present. So please proceed when you both are ready.
Good afternoon, Chair Donate and members of the Senate Health and Human Services Committee. For the record, my name is Charles Duarte, spelled D-U-A-R-T-E. I serve as the Nevada Public Policy Director for the Alzheimer's Association. And it's a pleasure being here today, and I want to thank you for the opportunity to present on Senate Bill 297, which establishes Nevada Memory Network. With me today is Dr. Peter Reed. He's the Director of the UNR Sanford Center on Aging, as well as the Chair of the Nevada Task Force on Alzheimer's Disease, and together we're going to be presenting information on this bill. So 297, SB 297 establishes Nevada Memory Network, and the association supports the expansion of memory assessment clinics, which this bill tries to achieve. It also seeks to enhance training of primary care providers for screening for dementia and services needed to support those living with disease, their families and caregivers after a diagnosis. Currently, more than 50,000 Nevadans are living with dementia, yet despite the prevalence of Alzheimer's disease in Nevada, less than half of adults 45 and older who report cognitive issues seek a diagnosis. The reasons are complex, that they don't seek a diagnosis or speak to their physician, but studies show that lack of access to an early and accurate diagnosis may be a significant part of the problem. A number of states have created programs to better achieve access to an early and accurate diagnosis, Georgia being one of them. Dr. Reed and I, as well as other community partners, have been working over the last year and have been in communication with Emory University in Georgia about their program, which is funded by the Georgia Legislature. And so we sought to create something Nevada-specific and special, and so we sought about creating a Nevada Memory Network. This bill was brought forward by the Interim Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs, and we're grateful to them as well for bringing this bill forward. Our partners in this planning effort that started over a year ago include the Cleveland Clinic Lou Ruvo Center for Brain Health, the renowned Neurology Institute, the UNLV and UNR Schools of Medicine, the UNR Sanford Center on Aging, and the UNLV Brain Health Department. Together, we developed a proposal that you see before you to expand memory assessments as well as statewide training for primary care providers and effective follow-up care. The model that I'm going to describe consists of 4 sections, and what I've done is provided the committee, and I believe it's uploaded in Nellis, with a infographic that kind of takes you through the system of care that we're proposing for through this bill. First of all, the bill seeks to enhance primary care provider screening and referrals. PCPs will serve as the most important part of the proposal by screening and referring patients to memory assessment clinics. And this will be done as part of a Medicare annual wellness exam. We would wish that there would be more neurologists and geriatric specialists in Nevada, but Nevada is considered one of 20 states where it's a neurology desert. And so those specialists who are trained in the diagnosis, differential diagnosis of different kinds of dementia, are very few and far between. And so we're going to have to depend, and do depend, primarily on the work of primary care practitioners throughout the state to do their best to try to diagnose the disease, but more importantly, refer them for a differential diagnosis to memory clinics. The second part of the bill establishes funding for memory assessment clinics. These will serve as the hub of the model, with the PCPs serving as spokes. Specialists in the memory assessment clinics, including neurologists, neuropsychologists, geriatricians, or even geriatric advanced practice nurses, trained in the diagnosing of dementia, will work with patients and their care partners. The MACs, or memory assessment clinics, will provide the necessary testing to obtain an accurate diagnosis, and will also work with the patient and care partner dyad on a care plan. The MACs, as well as their academic medical partners, will also provide ongoing training to PCPs to better screen and diagnose common forms of dementia. And then the MACs will also take full advantage of telehealth technology to assist PCPs and patients, particularly in rural Nevada. The third part of this is a handoff back to the PCPs, so a warm handoff which will allow the MACs to provide a comprehensive person-centered care plan to the PCP that involves the patient and the care partner. The care plan will also include caregiver training recommendations and resources. And then probably the most important aspect of this system of care that we're proposing are dementia care navigators. DCNs, or dementia care navigators, will provide coordination and referral to community-based services to meet not only the needs of the patient, but also the care partner. Access to in-home care, monitoring the well-being of the care partner, and access to care partner support such as respite will be part of the work of the DCNs. As I said, I provided an infographic that kind of goes over the patient flow associated with this proposal. We have 5 main goals for this proposal. First is to improve the screening of Nevadans with memory loss with a sustainable annual wellness visit model. The second is to establish memory assessment clinics, or hubs, in northern and southern Nevada. These will be a part of existing clinical partners that work with both public schools of medicine, the Cleveland Clinic, Lou Ruvo Center for Brain Health down in southern Nevada, and the renowned Neurology Institute up in northern Nevada that works with the UNR School of Medicine. Third, we want to improve patient health outcomes through an early and accurate diagnosis and support the needs of care partners. Fourth, we want to reduce the overall cost of care associated with the dementia diagnosis. We know through many studies that an early diagnosis does a number of things. Number one, it provides access to new treatments that are coming through the pipeline that will hopefully soon receive FDA approval. Number two, it gives the person in the early stages of the disease, which is sometimes called the mild cognitive impairment stage of the disease, an opportunity to be fully involved in their own care planning. And then thirdly, by having an early diagnosis and instituting in-home supports, you delay the onset of unnecessary hospitalizations as well as nursing facility care, which will save the Medicaid program significant funds. We know right now that, for example, the Nevada Medicaid program, as of 2020, spent $203 million on individuals with a dementia diagnosis, and that number is expected to go up 30% in the coming 2 years. The last thing we want to do, but not least, is support the oversight and evaluation of project performance and direct collection for research. If this is successful and is funded, we have partners that want to be involved in a research component of this, including the UNLV Brain Health Department and dementia researchers at the UNR School of Medicine. So with that, I'll conclude my comments and turn it over to Dr. Peter Reed to talk about the involvement of our community partners and academic partners in this proposal. And then after that, I'm happy to do a bill overview for you all.
Excellent. Thank you, Chair Donate and members of the committee. For the record, my name is Peter Reed, and I serve as the director of the Sanford Center for Aging at the University of Nevada, Reno School of Medicine, and also as chair of the Nevada Task Force on Alzheimer's Disease. I'm pleased to have this opportunity to share my support for Senate Bill 297, proposing to establish the Nevada Memory Network. As my colleague, Charles Duarte, has articulated well, the impact of Alzheimer's disease and dementia is significant in Nevada, and it is rapidly growing. We expect a 30% increase in the number of Nevadans living with dementia between 2020 and 2025, which is the third fastest rate of increase among U.S. states. With as many as 64,000 Nevadans projected to be living with dementia within the next few years, it is imperative that we develop more robust capacity to identify people who are living with dementia and provide them with ongoing support. This starts with an early and accurate diagnosis. Many people who may be living with dementia do not have a diagnosis of the condition that may be causing their symptoms, which is particularly true among people in the earlier stages. While there is no current treatment available to reverse the course of the major dementia-causing diseases, there are many benefits to receiving a diagnosis as early as possible. These benefits include enabling the person diagnosed with dementia while they remain capable to directly participate in conversations and decisions regarding their future, connecting people diagnosed and their family members with community-based supports and services to help promote a higher quality of life, accessing medications that may reduce symptoms and increase quality of life, and finally, receiving an accurate diagnosis may provide comfort by reducing the psychological distress that comes along with not knowing why cognitive changes are occurring. Over the past decade, through a great deal of hard work and extensive collaboration between Nevada's state agencies, universities, and community-based organizations, Nevada has emerged as a national leader in dementia innovation for community-based supports and services, professional education, and risk reduction. Highlights of this include the Nevada Aging and Disability Services Division receiving support from the U.S. Administration for Community Living in 2016 to launch Dementia Friendly Nevada, which is now led by the Dementia Engagement, Education, and Research Program, known as the DEAR program, at the UNR School of Public Health. There is robust professional education happening statewide through U.S. Health Resources and Services Administration-funded geriatrics workforce enhancement programs at both UNLV and UNR. And also, the Nevada Division of Public and Behavioral Health received funding from the U.S. Centers for Disease Control and Prevention BOLD Act initiative to partner with Dementia Friendly Nevada in raising awareness of dementia as a public health issue. Through these and many other efforts, Nevada has established a robust network of community support for people living with dementia and their families. However, these resources are only helpful when someone knows they may need them. Unfortunately, Nevada's healthcare system has lagged behind, with a limited number of specialists capable of providing comprehensive dementia assessments and diagnosis, as well as a primary care workforce with limited understanding of how to best fulfill their role in identifying potential dementia and referring patients to the appropriate specialists for thorough assessment. To the extent that there is clinical capacity, it is not well integrated in a way that eases the pathway for patients accessing the various services needed when facing this complex condition. SB 297 will help to close this gap in healthcare services by establishing an integrated statewide approach to identifying, diagnosing, and supporting Nevadans who are living with dementia. Launching the Nevada Memory Network is directly aligned with a goal for primary care provider outreach outlined in recommendation number 4 of the 2023-2024 Nevada State Plan to address Alzheimer's disease and other dementias, submitted to this body by the Nevada Task Force on Alzheimer's Disease in January of this year. I have included the state plan as an exhibit for your reference. Leveraging partnerships between academic, clinical, and community organizations, including Nevada's Public Schools of Medicine at UNLV and UNR, Renown Health Neurology, the Cleveland Clinic Lou Ruvo Center for Brain Health, the Sanford Center for Aging, the DEAR Program, and the Alzheimer's Association, an integrated network can be established to ensure that all Nevadans are identified when they are experiencing changes in cognitive function, that they receive a comprehensive assessment and an accurate diagnosis, and that they're connected with needed support and community resources on an ongoing basis. The model we have outlined, as detailed by my colleague, will be replicated in both northern and southern Nevada and extended to our rural communities through the use of telehealth. The Nevada Memory Network will be a statewide resource. I personally look forward to bringing the capacity of the Sanford Center for Aging at UNR's School of Medicine forward to help the Nevada Memory Network succeed. We will play a role in educating and training primary care providers on screening and referrals to effectively identify people at risk and refer them to the network's memory assessment clinics for accurate diagnosis. After a diagnosis is made, the Sanford Center will provide ongoing support and serve as a connector to enable people to benefit from all available community and clinical services. When developed and launched, the Nevada Memory Network will fill a gap in our state's clinical services for dementia. It is a needed resource for our ongoing efforts to ensure high quality of life and well-being for all Nevadans, including those living with cognitive impairment. I'm grateful for your time and the opportunity to share my perspectives.
Thank you so much. I think we can go ahead and skip going through the bill sections, considering that in the
Thank you,
interest
Chair.
of time, and there's not that many sections in this bill, so I think
Thank you.
it's pretty simple. I'll go ahead and let committee members ask any questions. And first of all, from someone that works in geriatrics, I think this is very impactful and very well needed. So, Senator Stone?
Well, thank you very much for the presentation. As a 67-year-old that seems to be losing his memory very fast, I might be one of the first to take advantage of this network. But certainly, when we see the baby boomer generation that's now retiring, I assume that's one of the reasons why you're seeing this spark, a 30% increase in Nevadans. Is that the case? Okay. And then also, as a part of the primary care, as a part of their well checkups, is this going to be including nurse practitioners to participate, physician assistants to participate? I know you mentioned telehealth in the rural areas, but I'm concerned that in some of the rural areas we may not have the professionals to do this exam.
Mr. Duarte, if you can make sure that you state your name for the record and answer the first question, because I think the mic was off. So,
Thank you, Chair Danyate. For the record, my name is Charles Duarte, and the answer is yes to their first question.
Thank you.
And with regard to participation of advanced practice nurses and physician assistants, the term primary care provider encapsulates all of those licensed professionals, so not just physicians, but advanced nurse practitioners and physician assistants who serve in that capacity as PCPs.
Okay. And then just finally, it says that this bill is going to make an appropriation to the Nevada system of higher education to support the establishment of the network. Can you tell me what the budget is and where the money is going to be coming from?
So, for the record, again, Charles Duarte, and Senator Stone. So the funding itself would go to the Nevada System of Higher Education, and from there through the schools of medicine to academic partners, which will serve as the clinical hubs for our memory clinics. The funding for this, what we did was we looked at part-time clinicians, understanding that it may be challenging for us to hire full-time neurologists at the types of salaries we're looking at. And just to be frank, neurology practices that specialize in doing dementia diagnostic work are not money makers. And so when you look to the state of Georgia, for example, and the work that they've done through their legislature, they have a much more robust, a much larger system that they're funding to the tune of about $7 million a year. These clinics are not breaking even and so need to be subsidized. So when we put together the proposal, we looked at a part-time clinician, a social worker, a medical assistant, and 2 care navigators per clinical hub. And so that would be 4 care navigators who would do the aftercare support. We also looked at patient revenue, and so we had to estimate the number of patients that could be seen with a 20% clinical member serving to see patients. And so we came up with an estimated clinical revenue in year 2 and then a slightly higher one in year 3. And then we looked at our costs and we offset the cost by revenue to come up with the subsidy amount. And I'm happy to provide the committee with the budget. But the subsidy amount that you see there is for the 2 years of the biennium and would support starting the program with the hiring of a statewide director in January of 2024, and then with the clinical services established 6 months later, I believe, and being fully operational in fiscal year 2024-25. So we put together, I think, a responsible budget, one that doesn't ask for the moon and the stars, but also takes into consideration patient revenue mostly generated from Medicare services. So I hope that answers your question. I'm happy to provide a copy of the budget to you. In terms of where the money comes from, that becomes a priority, I think, for this body and the governor's office. And so we're hoping that he can be supportive as well.
I just want to thank you for the presentation. I fully support your efforts. This is going to be a prevalent problem that we're going to have to be dealing with statewide, and I appreciate that you're both here to bring a program that makes sense to us. Thank you so much.
You're very welcome. Thank you.
Thank you, and that is correct. Section 2 of the bill says that it would be an appropriation from the state general fund to NCHE for the administration. I would request that you can please send the budget over to us so we can upload it as exhibits, at least for the committee members. So
Thank you. I'll do
yeah,
that.
Senator Titus.
Thank you, Mr. Chair. First, thanks for being at the table, and thank you for what you have done for Nevada and what you're hoping to do in the future. I do have some questions, and I hate to bring you back to earth here because this sounds great. However, I do have some concerns. First, I want to acknowledge that for me, it's always frustrating that we talk about Alzheimer's disease with dementia when both of you sitting at the table know that dementia is just an umbrella term, and there's many types of dementia, not to mention drug-induced dementia, and I throw that out to my colleague to my left. With the next hearing. But in any case, the reality is that dementia can be caused by a lot of things. And so thank you for bringing the term that you're talking about, dementias. And my concern, however, is that on the bill itself, under Section 1, and you go down to A, and then it's 1, 2, 3, 4, and then you go to B, you're going to employ or contract with people to serve as community-based dementia care navigators. Is that a new provider type? Will they be applying for NPI numbers? That's not something that I see on our typical. So could you explain to me that process?
Yeah, absolutely. So this is Peter Reed for the record. A dementia care navigator is a conceptual title that we're providing to them, not a new licensed type of provider. We likely would be hiring social workers into that role, certainly master's level social workers, and quite likely licensed clinical social workers who understand the network of available community resources and will be able to receive the recommendations from the memory assessment clinic and then help families navigate those resources that are available.
So at this point, that was just a words that you've come up with. There's no, because I wasn't familiar with that, and currently there's no such entity. Correct?
Well, there are people who are called dementia care navigators kind of around the country in different programs, but there's no specific provider type or licensed entity.
Okay,
it's
so
essentially a social work specialty, if you will.
So that brings me to my next question, if I might, Mr. Chair. I, as a primary care doctor, family practice doctor, who on my EMRs have to fill out when I see a patient, and I do mini mental status on those, part of that before I ever close that document. So we are doing dementia surveillance on our patients already. I've been asked as long-term care medical director to do competency testing on patients already. And then when I look at getting them referred somewhere, that's the problem, right? Getting them for treatment. There is already, as you both mentioned, such a limited supply of neurologists, people that I can then refer that patient for early intervention, possibly early treatment. And certainly I can prescribe some of the early Alzheimer's medications, but again, really require neurologists for that. So I'm worried that, as you mentioned, you won't have the staff for this. We don't have social workers now, and you're already putting in a program that you admit you can't stand up right now because of lack of personnel, that you're going to have to look at a part-time people come in and after hours, and so I'm just wondering, I love the concept of it, don't get me wrong, I'd love it in a real world if we had all the providers we need. It'd be wonderful to have this, but I worry that you're going to be diluting some of the staff, actually that we don't even have already, and so I'm concerned about the providers that you feel you're going to have when I don't think we have them.
Yes, again, this is Peter Reed for the record. Thank you very much for those comments. You're absolutely right that at the current time, there is limited capacity for us to make a comprehensive assessment and diagnosis of dementia. And that's exactly why we're putting forward this integrated model and an approach to build the integrated hubs in both northern and southern Nevada. So currently, there are neurologists in northern Nevada and southern Nevada, and they have extreme wait lists for people who are being referred, as you said, by primary care providers in for that comprehensive assessment. And what we hope to do is build an integrated hub model where it would not be solely the neurologist, but we would use the funds provided to develop this model to also support them with a neuropsychologist who is able to do the comprehensive cognitive assessment batteries that informs the neurologist's decision-making, as well as clinical social workers that are looking at the life situation and psychosocial risk factors that relate to the whole life and whole person experience of Alzheimer's disease and other dementias. So the idea being that we're going to create additional capacity in a specific integrated memory assessment hub, and over time, that hub team can be replicated. This is one of the interesting elements to this is that as you know, in clinical settings, there are certain services that are not billable. So the assessments and the work done by a neurologist, billable. The assessments and the work done by a social worker to provide psychosocial assessments and support maybe not billable as part of a hub team model. And that's where there's a need for leveraging both clinical, academic, and community-based partners, as well as financial support from the state to build out a model that subsidizes the elements that cannot be billed. And over time, hopefully we can recruit new neurologists. We won't be tapping into existing staff for the social workers. We'll be hiring new social workers that will be part of this team that will build out that hub and then create a replicated or a model that can easily be replicated as we're able to identify providers who are interested in moving to the beautiful state of Nevada to deliver their services.
Lastly, I know we want to move on here, and I apologize, and thank you, Mr. Chair, for one more additional question. It sounds great. However, I'm a realist. And is there anywhere accountability piece that if you, I see in here it says that after September 19th of 2025, if you haven't spent this money, if you haven't been able to stand this up, then it would revert and you would dissolve back. There's some, for me, it's like, it sounds great, but can you really get this done? And so, so I like that you did put in here that, hey, any money that we are allocated, if we haven't spent it, it may be transferred back. I'm just concerned that will you be able to accomplish this lofty goal? I hope you can. But I'm really concerned, and I'll see this on the money side if it gets to the money committees, because this is the policy committee. So I'm in favor conceptually of the policy, but I may have a different attitude when I'm on the money side of this. So I thank you for bringing this forward. Thank you.
And Chair Donate, may I comment to Senator Titus's questions? I think that you raise an important point, and I think Dr. Reed has kind of spoken to the fact that, and we've had these discussions with the medical director from the Lou Ruvo Center for Brain Health. We've had this discussion with one of the only neurologists that diagnoses dementias at Renown. And they have the same concern, that they're only one person. But again, we have to start someplace, and we have to bring forward proposals that will hopefully build capacity. And this is a discussion that we had over a year ago with representatives from the state of Georgia. They started this about 4 years ago, and they ran into the same issues. Convincing clinical partners to be a part of this, making sure that they could demonstrate that there is an effective way for patients to flow through their practices and be referred to memory clinics, and for the memory clinics themselves to be able to staff and support the positions that are needed to diagnose these diagnosed dementias. It took time, and it took a lot of effort on their part, but they've been successful, and we hope to be able to replicate that. I think, hope with a lot of motivation can lead to some pretty spectacular results, and we're hopeful, but we're also motivated to try to achieve this capacity for the 50,000 people that I represent as part of the Alzheimer's Association who are currently living with dementia in Nevada, and for those who don't have a diagnosis yet. So we are very aware of the hurdles, but we wanted to have the opportunity to be able to try to address this and increase our capacity to deal with patients who have a dementia, may have a dementia diagnosis.
Thank you. Thank you for bringing the bill forward. Thank you for the questions, Mr. Chair.
Of course, and that was Mr. Duarte for the record. There is one potential recommendation that I was thinking in my colleagues' round of questions, which is perhaps we can switch the employer contract with persons to serve as community-based dementia care navigators. Rather than creating a whole entire new subset, we could just say employ community health workers that have specialized training with dementia. That could possibly be an amendment that we can entertain, but we will talk offline just in the interest of time. That way it's already a set precedent and there's folks who have the adequate training. But let's move on to support testimony for this bill. So we'll go to support testimony on this bill, and then we'll start in Carson City, and then we'll move to Las Vegas and virtual. So, of course, we ask the same thing, if folks can limit their comments to 2 minutes each. We'll start with the gentleman in the middle.
Thank you, Mr. Chair. For the record, Darrell Brown, United Veterans Legislative Council, representing our chairman today, Andy LaPilbit, who could not be here because of prior commitments. As the panel knows, the committee knows, UVLC represents all major veteran service organizations in the state of Nevada and somewhere around 500,000 veterans and their families. So we have a pretty good substantial people behind us that come out and say, we strongly support this bill. It will provide excellent care and for us, whether you're a veteran or not. As you know, many citizens of Nevada served in the United States military, such as myself, and we're looking down the road, the gun barrel, if you will, at this problem. It's something that sneaks up on you. So this will be a great step forward to help people with dementia throughout the state of Nevada. On a personal note, I hope that the department will look at the Department of Veteran Services and the state veterans homes and their memory care units when they get this thing enacted. So thank you, Mr. Chair. I'm available for questions if necessary.
Thank you, Mr. Chair, members of the committee. For the record, Alejandro Rodriguez, Director of Government Relations for Nevada System of Higher Education, and she is in strong support of SB 297 and the opportunity for our schools of medicine to collaborate with partners on this very important issue. Thank you very much.
Good afternoon again, Chair Dunyate and members of the committee. Leah Case here in a new hat, the Nevada Public Health Association, to support SB 297. Dementia is a public health issue because the burden is large, the impact is major, and interventions can make a difference. And also strengthening the dementia care workforce is a public health priority, and SB 297 attempts to do just that. Thank you very much.
Good afternoon, Chair, members of the committee. Russell Rowe, here on behalf of UNLV and its president, Dr. Keith Whitfield. With a PhD in lifespan developmental psychology, Dr. Whitfield has been studying cognitive aging for over 30 years. He is a member of the National Advisory Council on Aging for the National Institute on Aging, and most of his $20 million in grant funding over his career has been to study health and cognitive aging in African Americans. At UNLV, we have one of the most prominent researchers of clinical studies on Alzheimer's disease and other outstanding faculty who study aging. Through our School of Medicine, Department of Brain Health, and our partners at the Lou Ruvo Center for Brain Health, we strongly support SB 297 and look forward to dedicating UNLV's resources towards achieving the goals of this legislation in Southern Nevada. Thank you.
Good afternoon, Chair Dunyate and members of the committee. For the record, my name is Nick Schneider, Policy Analyst for the Vegas Chamber. The Chamber is in support of SB 297. This bill brings our medical schools in the North and South into the fold to provide additional access to healthcare in a very challenging specialization. It provides additional opportunities for talent development. We urge your support. Thank you.
Good afternoon, Chair Dunyate and committee members. I'm Drew Franklin, DREW FRANKLIN with R&R Partners. I'm here representing Cleveland Clinic Lou Ruvo Center for Brain Health. This bill will increase early diagnosis and treatment for patients with dementias. That is why we are here to strongly voice our support for SB 297. Thank you so much.
Thank you so much. Anyone else in Carson City in support? Let's move on to Las Vegas and virtually. Oh. Is that a support? Come on forward. Please proceed when you're ready.
Hi, Cindy Brown. I represent Coalition for Patients' Rights. I did not know that this was going to be before the mushroom bill. Mushrooms will help with dementia. My husband is suffering from dementia, from a series of little strokes. He used to not be able to drive and follow the instructions on a GPS, and now he can do that again. Part of that is because of the mushrooms. The other part is following Dr. Dale Bredesen's protocol. He has a book out called Reversing Alzheimer's, and you guys need to know about that. And it's Dale Bredesen, Bredesen. Thank you. And I'm very much in support of your bill.
Thank you so much. So that was support testimony to Senate Bill 297. Again, we're not on the other bill, but if it's relations to the Nevada
I know that
Memory
you're
Network.
not on the other bill. The
You're good.
mushrooms do help with dementia.
You're good.
Thank you.
Thank you so much for your comment. Anyone else in Las Vegas?
All right, my name is Julie Montero. I'm a registered nurse in the state of Nevada. I am representing Compassion Center and Coalition for Patient Rights. We are in support of this bill. I know that dementia and Alzheimer's is a severe up and coming, and it's here, just like the other gentleman said earlier. We cannot wait. I know a lot of you want to move this and possibly wait, but one of the things that really touched home, this is on a personal level, my mother had Alzheimer's, and we were deciding whether or not we bring her to the state of Nevada or California where care would be taken. There were more services, of course, California had, but at the time, I know that there is a severe need for support systems and screenings and things like this. So I commend you guys, whoever came up with this bill. This is a very necessary one, and whether you realize it or not, you, a family member, or someone you know will come down with dementia. It's a fact. And we need to start having preparations in the state of Nevada. And if there's any way our organizations can help assist in research with that, do come out and reach out to us. I'll make sure I leave my contact information. And yes, we are in support of this bill.
Thank you so much. Anyone else in Las Vegas? Please proceed, ma'am.
Hello, sir. Good to see you again. I was there last week and met you personally. Good to see you again. My name is PJ Belanger. I'm here representing CPR as well as IPA and the other patient coalition rights. And most importantly, it's the Nevada Memory Care Network is needed. I'm 60 years old. I've been battling autoimmune diseases my whole life, all naturally. And if we don't have these implemented, it's people like me who are going to slip through the cracks. Lots of people that are aging that are trying to get alternative and choices in medical freedom. So this is really important that we not only pass this, but that we also take a look, like my friend Cindy Brown said, at the options that there are for memory care. Thank you. Enjoy your day.
Thank you so much. It's a pleasure to welcome you back for testimony. Anyone else in Las Vegas? And let's go to virtual.
If you would like to testify in
We have one more in Las Vegas, specifically on Senate Bill 297.
That is correct. My name is James Garvey. I am the president of the Las Vegas Psychedelic Society, and I support Senate Bill 297. I don't have a testimony prepared, but I wanted to state that I support this work as well.
Thank you so much. BPS, anyone else virtually, please?
If you would like to testify in support of SB 297, please press *9 or raise your hand within Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Let's move on to, we have one more in Carson City, and then we'll move on to opposition.
My name is Aaron Kraus. Good afternoon. It's AARONCROUSE. I suppose I'm here to represent people with dementia and Alzheimer's and families that also deal with that. In the early 2000s, my grandfather, after many doctor's visits, and a minor stroke, was diagnosed with Alzheimer's. And towards the end, the options for kind of care didn't look so good, and I became his caregiver for the last 4 months of his life. And I can tell you that, yeah, there weren't a lot of resources at the time, or a lot of people telling us what was going on, and it was an extremely unique experience for the person and the family, and yeah, kind of all over the place and really chaotic, actually. And it wasn't until hospice care, right at the end, where the hospice workers were able to educate myself and my family on kind of the what was going on, and the kind of the context of yeah, our experience, and that ultimately helped a lot at the end. But were there to have been resources earlier on, the experience would have been a lot different for everyone involved. And then a few years later, my grandmother on my other side, yeah, spent 4 or 5 years going through something that wasn't diagnosed until she passed away. And it was after an autopsy that they found out she had Lewy body dementia, and she was a lifelong resident of Clark County. And really the only thing, after many treatments and doctors, the only thing that ever brought her peace was acupuncture in the end. And so if there was more assistance, more resources, it would have made the experience a lot better for everybody. So I'm in support of this bill. Thank you.
Thank you so much, sir, for sharing your story. We'll go ahead and move on to opposition. Anyone in Carson City? Anyone in Las Vegas? And virtually.
If you would like to testify in opposition to SB 297, please press *9 or raise hand within Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. And anyone in this room for neutral testimony on this bill? In Las Vegas and virtually.
If you would like to testify in neutral for SB 297, please press *9 or raise hand within Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Dr. Reed and Mr. Duarte, did you guys have closing remarks?
Thank you, Chair Doñate. For the record, Charles Duarte. Again, I want to thank the committee for hearing Senate Bill 297, Nevada Memory Network. We're grateful for the opportunity to present this on behalf of not only the people living with dementia, their families and caregivers, but also the partners that went into putting this proposal together. So once again, thank you very much.
Thank you so much, sir. All right, we'll go ahead and close the hearing on Senate Bill 297, and we will move on to our last agenda item before public comment. But we're going to go ahead and open the hearing on Senate Bill 242. This bill revises provisions relating to certain controlled substances, and today we have Senator Nguyen presenting, and she also has co-presenters both virtually. So just for the knowledge of the committee members, my goal is to do the presentation first. We will have Senator Nguyen and her colleagues answer questions. If there are questions that you may have on the science, the study, the amendment, the bill language, etc., and then I would hope that I can invite law enforcement as well to answer any questions that you may have on the enforcement piece, and then we can go ahead and move on to testimony. So that's the plan of action. Senator Nguyen, whenever you're ready.
Good afternoon, everyone. For the record, my name is Rochelle Nguyen, and I proudly represent Senate District 3, and I'm here to present Senate Bill 242, and I think I just want to acknowledge and thank the chair in this committee for taking the time to hear this. I think this is the first time that we have discussed this topic in the state, and it is very much appreciated that we will have that opportunity to do so. I see that we have people in the overflow room here in Carson, as well as this room packed up, and it looks like there's about 40 or so people that are in Las Vegas to testify on this bill. And if I could just get a show of hands, how many times this is a first-time voter for people, or first-time participant in the legislative process? If you could raise your hands. And also in Las Vegas. That just brings me a lot of joy. I know that as legislators, sometimes bringing people into this legislative process so they can see the change is probably one of the more impactful things that I'm able to do as a legislator, and it brings me great joy to do that. I always start with how this bill became Senate Bill 242, and I will start with its origin story. And I like this story in particular because, as all of my bills do, they come from the communities that I serve. And I think that is how most of our bills come into fruition. And this was similar in nature. It started with a Lego exchange on my McNeil neighborhood Facebook page. So people ask, how does that happen? I was getting rid of a bunch of Legos from my children who were just collecting dust, and I wanted to make sure that they went out into the world and that other kids were getting joy from the learning experience of building those Legos. And so I put it like casually on my Facebook page, and I had a response from a neighbor a couple of streets down who said, I would love to take those Legos. And so she came over and we were chatting. She was asking if I was the same person that was on the ballot. And I said, yes, I was. At the time I was serving in the assembly. And I said, what do you do? And she said, I'm a psychiatrist in town. And we started talking. And I started talking about a book I had just recently read by Michael Pollan about psychedelics, about mushrooms, about what this bill has turned into. And Dr. Shaylee Jane told me, that is so exciting. I am so interested in that research. It's become a part of something that I'm doing. I see this is where the future is, and I would love to work with you on moving a piece of legislation forward that is in line with the science and get that research going. And that turned into what you see here today in the coalition that I've been fortunate enough to build. With that being said, I'm going to turn this next over to Kira Finch. She is an intern and student at the University of Nevada, Reno, and she is going to help in the presentation of this bill.
Good afternoon, Chair Dunyate and members of the Senate Health and Human Services Committee. For the record, my name is Kira Abagat Fincher. That's Keira Fincher. I am a Nevada legislative intern from the University of Nevada, Reno, representing Senator Rochelle Wynn's office today. I wanted to thank her for allowing me the opportunity to present Senate Bill 242 and thank the committee for giving me the opportunity of presenting this bill as well. Today, I am here to discuss the use of the controlled substances psilocybin and psilocin, psilocybin and psilocin being the naturally obtained substance from certain types of fresh and dried mushrooms. Today I have with me Assemblyman Max Carter, Dr. Dustin and Rochelle Hines, Bruno Moya, and Eduardo Martinez. In 1970, the Controlled Substances Act was signed, halting all research in the U.S. regarding the effects of euthagens on people. It wasn't until 2000 that a scientist was able to obtain FDA approval to study psilocybin and psilocin. Now, countless states across the United States have begun research regarding these effects and their benefits. The state of Oregon, which became the first state to legalize the adult use of the naturally occurring substance as of 2020, allows for supervised studies to use these substances to counter depression and post-traumatic stress disorder. In 2021, Texas Governor Greg Abbott allowed a bill authorizing the study of psilocybin to become law. Additionally, just last year, Colorado's Natural Medicine Health Act allowed for the use of psilocybin at state-regulated healing centers under the supervision of trained professionals. SB 242 protects and promotes the health, welfare, and safety of Nevadans and allows for the same vital research. In regard to our wonderful state of Nevada, we are facing a multifactored mental health crisis. Despite advances in medicine and efforts to broaden access to mental health counseling, Nevada is still facing alarming increasing rates of suicide and a stalemate in the variety of mental health services we can legally offer. Increased availability to mental health providers has been shown to be helpful in reducing rates of suicide, but as of 2021, our state in general and our rural communities in particular have a severe lack of providers. As a state, we are currently 8th in rates of suicide deaths across the country. And suicide is the 8th leading cause of death for Nevadans and the 2nd leading cause of death for Nevada youth. Nevada youth being people between the ages of 15 and 24. As of 2020, 47.5 Nevada veterans died by suicide per every 100,000 of the veteran population. And just to throw in another concerning statistic, the suicide rate for veterans was 57.3% greater than for non-veteran U.S. adults. Many veterans and first responders spend years cycling through various mental health providers and treatments and cannot find a treatment that works. As a result, many groups have stepped in to create access to this critical substance by flying veterans down to different parts of Latin America to use it in a place where it is legal. In doing so, they create hope for many of them, helping to rebuild our community of veterans suffering from military trauma recover and thrive after service. One such group is the Heroic Hearts Project started by former Army Ranger Jesse Gould, where veterans apply to participate in retreats to Latin America for access to psilocybin. Another group, Veterans Exploring Treatment Solutions, or VETS, started by former Navy SEAL Marcus Capone, helps create access for it and other natural medicines that show to be effective in helping veterans overcome their trauma. These two and other organizations recognize the value of these substances and dedicate themselves to ending the increasing veteran suicide rate by providing supervised access to psilocybin and researching into its benefits overseas. It is this same mindset that helps Nevada veterans, former law enforcement officers, other first responders, and adults over the age of 21. All in all, the therapeutic uses of psilocybin and psilocin is being recognized worldwide as a promising substitute for the already existing minimal medication used to treat mental health conditions. As a breakthrough therapy designated by the FDA, these substances are proven to be effective in helping with depression and PTSD, helping Nevadans who are struggling. As the validity of the research is finalized further, it's clear psilocybin has proven that it doesn't belong to be in the same category as cocaine, fentanyl, or any other substances found in Schedule I. With this being the case, it is critical that Nevadans are protected from prosecution for exploring solutions that work for them in the safety of their own home. SB 242 is simply doing what Texas, Oregon, Colorado, Washtenaw County in Michigan, and multiple cities in Massachusetts and Washington have already done. Open the door for more treatment options that work. Thank you.
And at this time, if I can introduce Assemblyman Max Carter. He has been just an incredible partner in this journey, and I am so happy that he is a co-sponsor in the Assembly, and I will turn it over to him.
My name is Max Carter, M-A-X-C-A-R-T-E-R. I'm Assemblyman from District 12, which is the east side of Las Vegas, base of Sunrise Mountain. And when I met Rochelle and we started talking about this, and she's telling me about this amazing person that she met, she just described. Finally, the pieces started clicking together. The woman she was talking about, Dr. Shaylee Jane, is my psychiatrist. And I want to tell you that a lot of people know my story. I'm very open. I believe in healing loudly, and that's why I'm talking here today. I've struggled with chronic depression my entire life and experienced firsthand most of the side effects associated with mainstream antidepressants. The only real medicine that I ever had was my wife, Karen, that was there for 30 years, that was a stabilizing influence that I didn't know I needed till it was gone. When my wife died traumatically 6 years ago, it amplified and intensified that underlying depression and layered complex PTSD on top of it. I've been working with a talk therapist since 2 weeks after the accident. Looking back, I can see several plateaus along the way in that 6 years where I thought, I got this, I'm good. And no, they were just plateaus, resting spots till I move to the next stage. And, so this is about recovery. And I say that, we have this picture of recovery and we think of addiction or alcoholism. Recovery applies to everything: mental health, grief, trauma, and addiction. It's all the same. And recovering from these traumatic episodes in our lives takes work. The most recent plateau or step up in my recovery has been ketamine therapy. My psychiatrist that we just talked about used this FDA-approved psychedelic as an aid in her treatment for major depressive disorder. The sessions occur in her office under direct supervision, and the effects have been transformational for me, helping to release me from the woulda, shoulda, couldas that were fostering the depressive episodes. Now, this bill is about psilocybin and its therapeutic uses. What I can say is that the difference from what I have read and what you'll hear other doctors in here talk about is that ketamine is a short duration. It's arguable whether it really is a psychedelic or not, or a dissociative. And it works. It's got very good short-term antidepressive qualities, and it also helps with that breakthrough that they talk about, building that trust. Psilocybin in the study shows that it is much more powerful, where I've gone through 8 or 9 ketamine sessions, probably would have been 1 or 2 if psilocybin was legal. And the effects of ketamine is measured in weeks and months. The lingering effects of psilocybin are measured in months and years. And that's why we need to take and look at this and allow it to be explored in our state. Right now, we've got veterans, active duty, first responders, and common people just like you and I that are seeking out and benefiting from psilocybin therapy. Unfortunately, it's happening in the shadows. This is the first step to bringing this promising therapy into the light where it belongs. And thank you for listening to me.
Thank you. Rochelle Wynn for the record again. At this time, I would like to turn this over to Dr. Dustin and Rochelle Hines, and I believe they're in Las Vegas. I see them at the desk. We talk a lot about research that is taking place in other places, whether it's Ohio State University, Johns Hopkins University School of Medicine, Imperial College in London, and other places that are conducting this research. Part of my impetus in bringing this bill are those 2 individuals sitting there, because they are professors at UNLV here in the state of Nevada. And so I would love for them to talk more about the science behind these substances and how they work, and the opportunities for research that are needed to be proactive in dealing with this research, that are here. So I'm going to turn this over to them.
Thank you, Senator Wynn. Good afternoon, Chair Donate, esteemed committee members. It's with a great honor and appreciation that I'm here to help present SB 242 today. And again, thank you to Senator Wynn for bringing the bill forward and inviting us to present on this. So my name is Dr. Dustin Hines. I'm an assistant professor at UNLV. I have a PhD in neuroscience. I have over 20 plus years of studying the brain. And more importantly, my passion has always been to find more effective therapies for disorders for mental health, because really there have not been new improvements since the 60s or 70s.
My name is Dr. Rochelle Hines. I'm an associate professor of neuroscience at UNLV. My PhD is also in neuroscience, and I also have over 20 years of experience studying the way the brain communicates through chemical neurotransmitters, and also studying substances and the way that they act on the brain. And together, Dustin and I operate a lab that studies the effects of substances with a therapeutic potential, and we operate this lab using DEA researcher registrations. Our work is published in some of the top journals in our field, and we're both very highly cited researchers with thousands of citations of our work.
So it's this experience that we bring for your consideration today.
And it's well known by the people of Nevada, and we've already talked about this, that we are facing a mental health crisis. And I'm going to repeat it because I think it's important for us to go over this. We are nearly double the average for suicides in the state, the national average, and it is the second leading cause of death of people between 10 and 34. That's not something to be proud of. Something that is to be proud of is that we have over 200,000 veterans in the state, but our veterans need better mental health. And so one of the ways that we can address this is looking at common ailments like PTSD, operator syndrome, and provide a better quality of life, and then also decrease the risk of death by suicide. I talk about this all the time to people. We look at depression and we don't think it's a lethal disease. It is a lethal disease. As a scientist with a career that's focused almost solely on innovation for mental health, we came here to speak about the growing body of evidence that suggests that psilocybin and other psychedelics and the compounds within psilocybin, specifically magic mushrooms, have the potential to be very safe and very effective treatments for mental health conditions, including PTSD.
Rochelle Hines again for the record. Studies have shown that psilocybin can bring relief for patients suffering with PTSD, treatment-resistant depression, substance use disorder, and other indications are under investigation. One study conducted at Johns Hopkins University found that a single dose of psilocybin, when combined with psychotherapy, was associated with a significant reduction in depression and anxiety symptoms in patients with life-threatening cancer. A recent New England Journal of Medicine article demonstrated that a single moderate dose of psilocybin, along with psychological support, provided significant relief of treatment-resistant depression symptoms for at least 3 weeks. And this moniker, treatment-resistant depression, is worth noting. These are patients that have tried at least 3 other therapies and had no relief from their symptoms. Another study published in the Journal of Psychopharmacology found that psilocybin-assisted therapy was more effective than conventional treatments for smoking cessation. And an article in the Journal of the American Medical Association found that heavy drinking days were significantly reduced in patients with alcohol use disorder following psilocybin-assisted therapy.
Dustin Hines for the record. We're also beginning to understand how psilocybin works. And so we have all these connections in our brain. We call these synapses. And we call the activity of putting synapses together plasticity. And so plasticity is kind of something that is regulated past development, meaning it's hard to get new synapses to form all the time. And this is what we believe that psilocybin is doing. So a recent study published in Neuropharmacology also shows that you get these special new type of synapses called philophodia. And this is research in our lab now that we're looking at not only with psilocybin and many other psychedelics, where we can show very readily in areas of the brain that are really important to be connected or reconnected in disorders of mental health. These compounds are highly effective.
Rochelle Hines for the record. While some may be concerned about the potential for psilocybin to be abused, studies have shown that it has actually quite a low potential for abuse. As already noted, evidence in fact suggests that psilocybin may be effective in treating the abuse of other substances like alcohol and nicotine. And epidemiological studies have also shown that lifetime psilocybin use was associated with lower odds of opioid use disorder, and that is currently under investigation as well. Research also shows that psilocybin has a wide therapeutic window with little to no toxic effect on the body or brain. And it's also very important to note that psilocybin has been used safely by experienced and skilled practitioners of traditional medicine in multiple cultures for millennia. Recent major national surveys also indicate low rates of abuse, low rates of treatment seeking, and low rates of reported harm resulting from psilocybin use.
Justin Hines for the record. Given the growing body of evidence supporting the safety, the efficacy of psilocybin, we urge you to consider a growing body of research that we brought for you today and consider Bill 242. Doing so will provide a path for new potential effective treatments, and truthfully, it'll put Nevada at the forefront of this research and these types of treatments. Thank you so much for your attention on this very, very important issue. We hope to take this opportunity to improve mental health for Nevadans, and this is an amazing step forward. Thank you.
Thank you, and I appreciate this committee's indulgence. I know that this is the first time we've discussed this, so I do have quite a few people that I think it's important to kind of see the different aspects of how impactful this legislation would be. Next, I might have to kick some of you all out here. If we can bring up Bruno Moya and Eduardo Martinez to come and also provide their perspective. And I have to just say, I love Assemblyman Carter's healing loudly. It's going to be my new mantra.
Ditto. Good afternoon, Senate Health and Human Services Committee. My name is Bruno Moya for the record, and I'm a United States Marine Corps veteran of the Iraq War, a social worker in the state of Nevada since 1989. I want to first thank Senator Rochelle Wynn and Senator Fabian Donate for the courage to pick up this bill. My hope today is to help educate and encourage those who may not be as open to non-ordinary mental health treatments and how psilocybin has changed my life and the life of so many veterans in the community. In 2008, I decided to take a leap of faith and try for the first time psychedelics. I am currently in a program out of the country for psychedelic therapy, where we have academic and tribal teachers from Dr. Robin Calhart Harris from the Imperial College of London to Dr. Torsten Passy, a leading researcher and psychiatrist from in psychedelic therapy. That night's experience changed my life and trajectory in a way that I would compare to stuffing years and years of therapy into one night. This treatment allowed me to look and explore those areas in my life that were causing me the deepest wounds, hindering me from having a fulfilled life. What I experienced growing up in a border town in Mexico, trauma from war in my childhood, and an inability to feel and instead just go through the motions was a typical day. Due to the experience that kept causing my emotions, after my experience with psilocybin, my inability to feel was washed off. I come home the next day, not just from a treatment, but I felt like I finally came home. In Iraq in 2003, my unit took the southeast side of Baghdad, where the Defense Ministry was located. Upon arrival, we began taking heavy fire. And at the end of the day, we had taken the Defense Ministry. This victory, as it seemed, came at a cost of many civilians and families attempting to escape the city who were caught in the crossfire. I remember one such family that made a wrong turn and drove straight into our line of fire. They earned a permanent spot in my mind every day and has lived there ever since. Ever since getting out of the Marines, I have difficulty settling down. I had difficulty settling down. I was emotionally numb and hypervigilant. But in 2018, after my first experience with psychedelics, that changed. Although my post-traumatic stress disorder symptoms are not entirely gone, my relationship with my wife and daughters has changed. From 2006 to 2018, I told my wife the words, "I love you," only a handful of times. And for the record, if my wife is listening, I love you. I had to travel outside of the country to get treatment. Think for a second how unsensible it is for a mental health professional to ask someone suffering from these debilitating mental health issues to update their passport, buy a plane ticket, go to another country just to get help that we have the power to offer in the state if Senate Bill 242 is passed. There are states in our union that are changing policy around psychedelics. Let's not be the last one to change. The compounds we are talking about today are medicines that have proven time and time again with real people that are not what many think of them to be. Veterans, first responders, medical and police departments and communities bear so much trauma and weight to keep us safe. At the same time, the substances that provide the most significant positive results are illegal and yet some of the safest. This bill would allow the study of psilocybin-containing mushrooms, substances that the veteran population are loudly advocating for, that I am advocating for, due to the potential to heal us and allow us to finally come home. Decriminalizing psilocybin to the proposed amounts may sound like a big gamble, but science and the truth tell us that this substance is safe. It is not addictive, no known overdose quantities, and have been found for most people. One time is all that is needed. It is also entirely safe, safer than alcohol, which has zero medicinal use. This bill would designate a working group of 12 Nevada residents and advise the state on its findings. The bill aims to allow members of our community struggling with severe mental health to possess a substance with significant potential to heal their wounds. I work with veterans on a daily basis. My wife is a trauma nurse in Las Vegas. I am familiar with the dire situation of our veterans, police, first responders, and medical professionals and what they deal with. My study in PTSD and moral injury has led me to understand that psychedelics have the best long-term positive effects. As a social worker, I'm in the trenches every day. Psychedelics are not part of the problem that people suffer from. As some people will lead you to believe, it is a clear answer. I urge this committee to pass this bill, and it takes courage to make a real change with our current state standings in mental health treatments and success. In access, this bill would change that for so many. Thank you.
And then finally, if we can go to Eduardo Martinez.
Good afternoon, Chair, members of the committee. Senator Nguyen, thank you so much for allowing us to be here. And Senator Nguyen, thank you so much for being willing to sponsor this bill, as well as you, Senator Donate. I am here as a lobbyist helping to present this bill on behalf of Decriminalized Nature Nevada, but I'm also a Marine Corps veteran. I served in Afghanistan in 2012 and have actually worked with the veterans community here in the state over the past 7 years. And before I start off my testimony, I want to leave this question, or start off with this first question. Is it a crime for an individual to want to heal themselves? Over the past decade, as awareness of suicide among our veterans grew, so did awareness of the ongoing mental health epidemic our state is suffering from. In recent years, many Nevadans were pushed to the edge with the Route 91 shooting, the isolation caused by the COVID-19 pandemic, and increased tensions between our law enforcement community and the public they were sworn to protect. It is said that 22 veterans take their lives every day in our country. But in our state, according to the CDC, 603 Nevadans in 2020, 642 in 2019, 657 in 2018, and 627 Nevadans died by suicide, a rate that is nearly 2 a day. Many of these Nevadans are veterans. Many are former law enforcement. Many are firefighters. Many are frontline healthcare workers and everyday Nevadans who have reached the ledge and left behind thousands of devastated families, neighbors, and their colleagues. However, what often isn't discussed is how many of these individuals that reached that point avoided this tragic fate because of something they found. Sometimes this is because of church. Sometimes it's volunteerism, community involvement. But for some, this is a substance that is now known as psilocybin that is being brought up in this bill. As a state, we've taken the initiative to address this challenge of mental health in our state head on. We stood up the Office of Suicide Prevention and initiated our participation in the Mayor's and Governor's Challenge teams with the purpose to prevent suicide in our state by helping to connect Nevadans in need to mental health resources found in the state. But since 2019, we have faced the same problem. Our community leaders, faith leaders, community coalitions tell us to seek help, but help is months away. If you are lucky enough to get an appointment, you are praying that the therapist you are signing up for can truly help you get better. For those that can't afford it, and for those that can't make an appointment, they've taken steps back and feel that these leaders have misled them, pushing them down a path of developing more mental health problems by turning towards a bottle of alcohol, unleashing their anxiety and frustration with their families, or turning to the illicit market for relief. With SB 242, it doesn't have to be this way. Existing law says that psilocybin is a Schedule I substance that has a high potential for abuse and no accepted use for medicine here in the United States. After 20 years of research, we know that this is not to be the case. We want to work with our law enforcement agencies to maintain public safety, and we've heard their criticism regarding the existing use of psilocybin, whether it's with our veterans, former law enforcement officers, and every Nevadans, that they are self-medicating in an unsafe manner. The honest reality is that even without psilocybin, many of these Nevadans are attempting to self-medicate. With our current laws, it's unfortunately okay to do so with alcohol, gambling, antidepressants that leave you numb to the world. However, somehow our state has created a perverse incentive for our veterans, our law enforcement officers, and everyday Nevadans to think it's better for them to turn to the bottle of alcohol instead of using a natural medicine that's anti-addictive and is safe to use. Are there risks associated with psilocybin? Yes. But just like anything else, it's a substance that should be used responsibly. But because of our laws, our communities lack an understanding of it because the people most knowledgeable in this space fear prosecution by our law enforcement. Were this body to adopt SB 242, the greatest beneficiaries would be our veterans, our law enforcement officers, and everyday Nevadans over the age of 21. Our colleagues in the law enforcement community will say changing existing laws increase the dangers our officers face. We disagree. This is because this hasn't been the case in other jurisdictions that have reduced the prosecutable penalties associated with psilocybin. We support our brave law enforcement officers for the risk and dangers they take on, but we also recognize that they, like our veterans, are susceptible to developing PTSD, anxiety, and depression. So in return, we ask our law enforcement officers, or law enforcement agencies, how many officer suicide are too many? How many lawsuits for wrongful death or injury are preventable had our officers had the opportunity to use a substance like psilocybin to manage the symptoms of post-traumatic stress? How long will our law enforcement agencies ask our officers to turn to the bottle of liquor instead of psilocybin when it's a crime they rarely prosecute for? Senators, we ask for your support on SB 242 and ask for your help in destigmatizing mental health to stop prosecuting our heroes.
And I'll just briefly say, there's just so much stigma that exists around mental health, but probably more so with our first responders, our veterans, our police officers and law enforcement officers. As someone told me just here today, they're the people we call when we need help. They're the ones that we call when we're desperate and we need help and we need assistance. That stigma exists not only for them, and for them to heal loudly, as Assemblyman Carter said, they are not used to asking for help. But we do hear them, and we do hear their calls for help, and we know that Senate Bill 242 will help them. As Kira previously mentioned, and all of the co-presenters that have been here today, and those that will come and testify in support of this bill, veterans, law enforcement, first responders, all Nevadans deserve the right to explore treatment options in the safety of their own home. We want to reduce the prosecution of people who wish to heal themselves and protect those who protect us. It's the least that we can do. And I'll turn it over for any questions you might have.
Thank you, Senator Nguyen. Before I make my statements and my questions, and I know my colleagues will have questions as well, I want to thank, of course, Assemblyman Carter for sharing your story, and of course to you gentlemen for your service, and of course it's a pleasure seeing Bruno again. We went to college together, and to Dr. Hines, we've chatted before, but I haven't had the chance to meet you, so at least this is the closest we'll get. Although I wasn't alive in the 1980s, the ramifications of the war on drugs we still see to this very day. I think that's something that all of us can see in general throughout this country. The fact of the matter is, what we have seen, particularly with this issue, is we have forbidden our researchers to actually understand what this process could entail. And that has persisted for generations. But in the same breath, this has been in cultures longer than any of us have been alive. And I think that as public health folks, it is our due diligence to ensure that we have the precautions in place and that we actually have the opportunity to monitor it from a clinical setting. That is something that is our entire obligation before we have any further conversation. And so, Senator Nguyen, I have a quick question for you. So could you please reference to the amendment that has been posted on Nellis, and the committee members have that as well, and talk about the criminal penalties that have been established in your amendment, please?
Thank you. Thank you for bringing that up. One of the things that I really wanted to take a look at, and you highlighted it actually perfectly for me, is kind of this failed war on drugs and this failed classification on how we look at drugs. I've been in my civilian job. I am a criminal defense attorney, so I've seen this, firsthand, the disproportionate treatment that we have with drugs. When I look at our existing language, and the reason that I included this, and I thought it was important to include, address the criminal penalties and the criminal provisions regarding simple possession of these mushrooms, is because I think it's important to look at it. Right now, under current existing law, under NRS 453.336, if you have possession, even if it's for personal use, of 1 ounce of mushrooms, that is punishable as a Category B felony, and it carries with it anywhere from 1 to 10 years in prison and a fine of not more than $50,000. You'll be able to ask any of the law enforcement officers or district attorneys that might be here to testify in opposition here today. That is the same penalty and the same distinguish. We don't make a distinguish in our laws currently between a possession of 28 grams of mushrooms and 28 grams of fentanyl. And for anyone that knows about fentanyl, 28 grams of fentanyl is not the equivalent of 28 grams of mushrooms. And they are treated in our law the same. There are other penalties. Category B felonies, for people that are not familiar with the criminal system, Category A felonies are the very top type of felony. That is murders, life sentences. They carry life sentences, rape, child molestation, those kind of charges. And those are the serious charges. Right below Category A is this, a Category B felony. This is one of the most disproportionate penalties and punishments for this type of possession. And the fact that we treat those all similarly is problematic. 28 grams of meth, 28 grams of mushrooms, 28 grams of fentanyl, 28 grams of heroin are not all the same. And the reason that I felt that it was so important to put that distinction in here, we tried to do what should be done with other things, quite honestly, throughout the statute when it comes to drugs and drug possession, is make that distinction that this is different. I did put this in combination with the study because I truly believe everything that we've heard here today. We need to be the forefront of that study. If you talk to Dr. Hines and Dr. Hines, they will tell you that this is also putting us potentially in the area where we could be on the forefront of this kind of, bio research and this kind of, research, not only for the country and the state, but also from the, in the world. And I would love for people to come to Nevada to want to figure out where the cutting edge research that comes for addiction and post-traumatic stress and depression. And we're hearing about research studies coming out on brain repairing after strokes and all kinds of other things. And I'm sure there's lots of people that will testify in very different areas about what they are. So that's kind of that's the main, reason that I felt it was important to include that, because I do think there is a difference between 28 grams of mushrooms and 28 grams of fentanyl. And this is reflected in this amendment and this ability to, step down and look at this reasonably.
Thank you, Senator Nguyen. And just one last question for Dr. Hines. What has been the perspective from the researchers? Have there been RFPs from the NIH nationally? Is there a grant process that has been more prevalent over the years that you're seeing? And of course, because of the law, how it's written, you're being forbidden from applying. What's the perspective from the researchers?
So I would say up until about,
Name
Dustin
for the record,
Hines for the
please.
record.
There you go.
I would say up until about 2 years ago, most grants that we would put in on the subject would probably be denied, truthfully. I would say in the last year, there's a tsunami of people putting in grants, and there's a big change. People are now understanding that these compounds are changing lives. Part of that is because some of the MAP studies, part of that is because some of the Hopkins studies, but this is becoming the new mental health area, as Senator Wynn said, because we haven't had any solutions for 40 years, and there's all kinds of new novel things that we can understand here.
Thank you so much. I think I'm good from my side. I'll go to Senator Stone.
Thank you, Mr. Chairman, and thank you, Senator Wynn, for starting the discussion. And I also want to say to my friend, Assemblyman Max Carter, my condolences. I didn't know about your wife, and I'm sorry to learn of your health issues. Just so you know that I'm a pharmacist, and I had a compounding pharmacy in California, and actually one of our specialties was making topical and oral and injectable ketamine to help people such as yourself, and we did see some significant responses. I also want to thank our veterans for being here today, and you know, I've seen the evidence of what some of these hallucinogens can do when it comes to depression, alcohol cessation, drug addiction, PTSD. And I also understand a lot of the pharmacology. And when I'm talking with Dr. Hines, and the way I remember in pharmacology that psilocybin kind of mimics the effects of serotonin, if I remember correctly, and it tends to cause explosive neuronal activity that tends to reach certain areas of the brain that conventional medications don't. Can you just comment on that in your research? Has research kind of changed that a little bit, or is that still the way that these are thought to work?
Rochelle Hines for the record. Yes, these drugs all have a common mechanism of action targeting a specific type of serotonin receptor. The name of the receptor is not so consequential, but it's called the 5-HT2A receptor, and 5-HT is just another way of stating serotonin. And what has been shown is that after using psychedelics, there is increased functional connectivity in the brain. That means regions of the brain that were sort of cordoned off from communicating with other regions are now interconnected again. And research like we can do in our lab, where we look at animal models, we can actually see physical changes in the structure of neurons and the connections that they form with other neurons. And so, you know, although research has been difficult and acquiring a DEA license is extremely hard, we have been able to do some of this research and uncover some of these mechanisms ourselves, and you know, see this powerful effect that these substances have on brain connectivity.
Thank you for that. Doctor, did you have something to add? I'm sorry. So I graduated pharmacy school in 1981. I think Dr. Titus graduated in 81. I think it was probably before you were born, probably, right? So we're really aging ourselves, but I think both Dr. Titus and I have both taught at the university level. And so we come to the table here with a lot of years of experience. And the first thing I want to discuss is the inconsistencies with the scheduling of drugs. It's hard to believe that today marijuana is still considered a Schedule I drug, right? I mean, I don't think there's any question about the efficacy of marijuana, and I was one of the earliest proponents of medical marijuana when I was a elected official in California. And not only do I believe that, but actually the federal government believes it as well, because you got the DEA saying it has no medicinal value, but you have a drug called Marinol that is a THC derivative that is FDA approved by another federal agency, right? And because it was on a Schedule I list, it didn't allow for research and development to further identify the utilization of THC for a number of things like medical wasting, et cetera. The same issue is for psilocybin, and I appreciate that we have some researchers that have been doing this. I'm sure many of you have seen some of the documentaries on psilocybin, the books that have been read. There's no question in my mind that there is medical benefits to it. The federal government, you know, needs to get into the rescheduling of these drugs so we can do the appropriate research and development on them. But the common theme that I've heard here today, and I agree with many of what I think we're about to hear in the way of treatments, is that a lot are medically supervised. So when we first came out with the legalization of marijuana, we came out with you had to have a prescription from a doctor, right? We wanted to monitor. We wanted to make sure before we blanketly made it legal without any physician oversight that we were analyzing all the potential side effects, drug interactions, et cetera. And of course, we have significantly progressed over the years. It is now legal without a prescription. It can be used recreationally. I have no problem with the committee that's being proposed here to look at it, to study it, report to us. My concern is that somebody that is not as familiar with magic mushrooms, a young child, gets their hands on it, and if we do make it quasi-legal in the state, are we going to encounter some of the quality control issues that we've discussed earlier? And I agree with Senator Wynn about this, why 12 grams of fentanyl is equivalent to 12 grams of magic mushrooms. That's apples and oranges when it comes to the lethal dose and 50%, the LD50 as we call it, in killing people, right? 12 grams of fentanyl will kill a lot of people, where 12 grams of magic mushrooms will not. But the research has also shown this drug has very little abuse. It's very difficult to become physically addicted. You could become mentally addicted to it. And the risk of long-term side effects that I would say are more associated with a drug like LSD, to have dangerous flashbacks, is not something that is reminiscent with this drug. So my concern would be quality control. So if we quasi-legal it, as many of you know, there are a number of varieties of mushrooms that have this ingredient in them, but we also know that there's a variety of mushrooms that have significant toxicity, poison, that they can damage your liver, they can damage your heart, they can damage your kidneys, they can cause your life. So I'm worried about quickly opening the floodgates, and then we get cartels that are putting mushrooms out there that people have no idea what's in those particular mushrooms. So I want to just say that I appreciate all of you that have taken the time to come here today. You're going to give us some very compelling testimonies today. I agree with many of the indications that traditional medications have not been able to effectuate help. I'm also aware of the suicide rate in Nevada. It's alarming. I'm very much aware of the suicide rate of veterans, 22 to 24 a day. That's got to be mitigated. And psilocybin can prove to help with PTSD and help some of our veterans. I'm all in favor for it. So I'm just going to say this as a summary. I think psilocybin has a place in our medical armamentarium to treat conditions that historically have not been able to be treated. I also believe that if a medical doctor or a psychobiologist, a PhD, is involved in treating patients, that I don't believe there should be any criminal penalties at all. If you're under the supervision of a healthcare professional, there should be no criminal penalties at all. And then if we can come up with some type of a framework where we can ensure that there is quality control, that we also let people know that you shouldn't be drinking alcohol while you're taking psilocybin. You should be around family or friends when you take your first dose of psilocybin, because there are unpredictable effects such as rampant, very powerful hallucinations. Again, you're having neurons exploding in the brain and reaching areas that traditional pharmacological agents haven't been able to reach. So again, I look forward to this continuing discussion with you, Senator Wynn. It was very brave of you to bring this forward. There's a lot of people that I think can benefit from this drug. I just hope we can do it in the right way.
Thank you. Rochelle Wynn for the record. I would love to have a more expansive program that you're discussing. I think when you're looking at some of the places that have bringing about this type of legislation, it isn't coming through legislators. It's coming through ballot initiatives because people are speaking and they're speaking very loudly about their desire to do this. It is passed overwhelmingly in the 2 states that have had it on their ballots. And I think that's telling that the public want this. You know, we unfortunately had to wait for the public to tell us about marijuana too. And I think about how far we've come in that in the last 10 years or even the last 5 years on, you know, that has looked. Part of the reason I wanted to bring this and I wanted to bring it now is I want us to lead that conversation. I want us to know what that's going to look like. If you'll look at this, I didn't completely decriminalize it. And when you look at some of those states, quite honestly, the reason they're able to put together some of those programs for treatment and having doctors and facilitated places where you can go and seek this type of treatment is they had already decriminalized mushrooms completely. So Colorado did it, I believe, in 2019, and Oregon had done it around the same time. So when their ballot initiatives came forward, they were already in a position where they were situated to be able to do that. So part of the reason this bill is needed is, one, in order to study it, we need to allow people to possess it. And it does walk that fine line because federally it is a Schedule 1 drug. It's still a Schedule 1 drug here in our state statute. So that's where it is. This was an attempt to kind of compromise and also bring some common sense. Like I said, there's a difference between 28 grams of mushrooms and 28 grams of fentanyl, and our laws should reflect that. But I look forward to continuing to work with you. I know you're right next door to me, Senator Stone, so don't think I won't stop back in there and get some advice and opinions on what this bill might look like moving forward.
Thank you so much, Senator Stone. I think we're going to, just in the interest of time, move on to other questions. Senator Titus.
Thank you, Mr. Chair, for the questions, and thank you, Senator Nguyen. I do appreciate you bringing this bill forward because we do have to have a discussion about this and continuing to not allow any study or any research on drugs that have been available for time immemorial. It has to go past. We have to get rid of that. I'm looking more at the amendment and some of the questions about the actual bill itself. It's the bill I'm looking at. I'm not looking at the amendment, and you did raise the age to 21. Would that be the age that would also only age be allowed under a research category, or that's only for the possession?
I think that would be our intention, is that it was 21 across the board.
Okay, thank you. And you and I have had discussion. I'm also close to where your office is, and I have in my 6 rural districts a very large Native American population who use peyote, mescaline, and this bill does not address that. Is there any thought on the use of peyote? And I was wondering if the doctors Hines have done any studies along the use of peyote as another resource.
Dr. Dustin Hines, for the record. So yes, we are very fortunate. We have looked at pretty much every psychedelic there is, and we've looked at mescaline quite extensively. Mescaline is different. So this is what a recent paper that we're working on in the lab to go out to the public, to inform the public, is working on building on that. Every psychedelic is different, and every psychedelic will likely treat a different ailment better. So in our hands currently, mescaline, the main active ingredient in peyote, seems to be really good for alcohol use disorder. And again, these are all preclinical data. And then also, there's some psychedelics that have really rapid rise time, like DMT. Those aren't so great for people with anxiety. So mescaline is really good, again, for alcohol use disorder. And we think, the data aren't in completely yet, also for anxiety disorders.
Okay. Thank you for that. And I just want to acknowledge again, So I would say that I'm an old doc, as our pharmacist is to the far left, and we did indeed. I graduated from medical school in 1981. But hey, we came from the era where there was experimentation in the 1960s and 70s. It's only gotten more conservative after that, frankly. But I do have some concerns. I have concerns about possession, impairment. But I do want to acknowledge the folks that you brought to the room, the fact that 90% of the folks sitting in this room and the folks sitting in Las Vegas have never been in a legislative hearing that they're passionate about this to show up in this building. And I do want to thank you for that. And we do have to think forward in this state. Again, I have further discussions with you regarding the bill itself, but we do have to get past some of this archaic concepts about drugs in general. How can we study them if you don't have access to them? So thank you for bringing the bill forward.
Rochelle Wynn for the record. I do see this as a dynamic process, and I'm glad that we're having these conversations because every time I am talking to my colleagues and I'm talking to people that I'm meeting about this, there are other things that I think we can address, and I think we can come up with solutions that make sense. Hopefully people think that I'm just trying to come up with solutions that make sense, that are common sense. My attempts at crafting this amendment with this possession is another one of those common sense things. And I'm hopeful that we can get to a place where we are not treating fentanyl and mushrooms in the same breath, and they don't carry with them the same potential 1 to 10 year penalty, in that respect. So I appreciate those conversations, and I know we'll continue to have them.
Thank you so much. That concludes our round of questions. If it's okay, I would like to invite our law enforcement officials, if they are okay answering a few questions. I do have some as well. So if they can come and step forward, we can rotate folks out. Thank you so much for joining us. So I think the enforcement piece is important too. I was thinking of, obviously, that's when we move on to testimony, but I think there are some questions that I would have, and I'm sure my colleagues would as well, regarding the enforcement piece. So just a quick question. So it is my understanding that currently we don't make a lot of arrests for psilocybin. Is that something that you guys have collected data for, or has that ever been a conversation that you've had in law enforcement?
Thank you, Senator. Jason Walker, Washington County Sheriff's Office. You are correct. We do not run into a lot of mushroom arrests. The cursory data that I was able to gather during this presentation, we ran into large amounts 4 times last year. We don't run into small amounts of mushrooms. We generally run into one, for example, 3.1 pounds. When we run into them, generally it's with other drugs. That's from the Washoe County side.
Director Beth Schmidt from the Las Vegas Metropolitan Police Department. So we've tried to gather the data because we didn't know you were going to ask us to come up. So one of the things I can tell you is that our narcotics section, that's the main section that's going to come in contact with psilocybin. We impounded 29 pounds last year, and that's just the narcotics section. So that's dry psilocybin. Now, keeping in mind, this is our understanding. We may need to speak with the doctors about this, but our understanding is that 0.01 to 0.05 is the average dose. And please, the doctors in Vegas, correct us on that if we're wrong. Does that sound about right?
Dr. Hines?
Dr. Hines, for the record. So dosing for this is a little bit muddy, mostly because there's all kinds of conversions between ounces and grams. So an average dose would be 1/16 of an ounce, which is about 1.75 or 2 grams. A massive dose would be about 5 grams. And then there's something called microdosing, which is about 0.1 of a gram or 100 micrograms, if that's helpful.
Okay, thank you. Yeah, it is. So when you think about 1.75 to 2 grams, we recovered 29 pounds. So I'm sure there's someone that went to UNR that can do the math on that, but it's a lot. And that's dry, so that's dry. It's going to be more than if it was, so that's 13,000 grams. That's what we recovered. Predominantly, we are not, and we're trying to find that data, but the street arrests of someone with a little bit of psilocybin in their pocket, I'm not even sure that our patrol officers would necessarily know what they're looking at. And it's small amounts. But what we are seeing is that I think the most terrifying thing to us is that with so much fentanyl out there right now, what we're seeing is recreational increase in psilocybin. That's the concern. And we're seeing that increase in our nightclubs, and we're seeing it at the large music events. So we talk about arrests. We had a large music event in Las Vegas, and last year, there we ended up making 19 arrests for narcotics. That was 19. Now, this is a multi-day festival, hundreds of thousands of people. In that, we impounded 437 grams of psilocybin. So just to give some perspective, but the main thing that we're seeing is there is a market for psilocybin for recreational, and that's what our narcotics section is seeing. And so what they're seeing is that recreational market is driving the production, it's driving the sales. And so where we are recovering those 29 pounds, it's predominantly in narcotics section warrants. So when we're doing search warrants, and there are other drugs present.
Thank you. And so just to, I think for my clarification, so when, for instance, in the example that you used at the music festival, so in general, and I know you don't have the data points, which is fine. I think there are, I would like to hear just your personal experiences or from the officers that you've worked with, for both of you. Generally, do you see that, are there individuals that only carry psilocybin, or is it like when you stop them, they're carrying other substances as well?
Jason Walker, I've run into both.
Yes, our narcotics, to Beth Schmidt, for the record, our narcotics detectives are telling us that they're seeing multiple, and that's why they weren't able to break it down from that large event. They said it was, they talked about other drugs that were covered. Another point that I'd like to make is that we also have at the Las Vegas Metropolitan Police Department an overdose squad, and so they go out on fentanyl overdose deaths. Last year, we recovered 6,700, so 6,700 grams of psilocybin at the scene. They were not the cause of the overdose. These were fentanyl overdose deaths, but we also found there, over the course of the year, that team going out 6,700 grams of psilocybin.
Thank you so much. And then I sit on revenue, so I've asked this question before, so you won't be caught off guard, but talk to us about the wellness programs that you have for your officers. I think that is something that folks alluded to in the testimony, so I just want to, I know that many of you have already started doing that process.
Sure, Beth Schmidt, for the record. Yes, Sheriff Kevin McMahill, this is a priority of his, is the wellness of our officers, because his feeling is if we have to take care of our officers, we have to take care of our EMTs, we have to take care of our firemen and women. If we want them to take care of our community and address the issues of homelessness and mental illness and addiction, then we have to focus on our officers. But the reality is that our officers are not, they're not allowed to use marijuana. And also, psilocybin is prohibited at the federal level. So there would be no opportunity for our officers. It wouldn't be allowed per policy for them to use this. And I think we are looking with our officers, with our employees, all of our employees is looking at data-driven, peer-reviewed programs, and that we'll get into this in our testimony, that we don't disagree. There is research going on, and we would benefit in the state of Nevada by looking to other states. But as far as a wellness program and the reality of Las Vegas Metropolitan Police Department officers and employees having access to psilocybin, absolutely not.
Jason Walker, officer wellness is top priority at our agency, to include LCSWs that work there on staff. They're there 24 hours a day. We have peer groups that are working shoulder to shoulder with us right on the patrol calls. So those are the clinical social workers, and we reach out to them. The stigma of, I can't go talk to the psych doc, those days are over. I mean, we're only as good as we are good. And, you know, healing out loud, to use that example, I mean, we have to. So we are very much with mental health.
And Sergeant Beth Schmidt, I would like to echo Sergeant Walker on that for us, when I started my career, we never talked about mental health. We never talked about being afraid. We never talked about trauma. We never talked about PTSD. And it is such a welcome change to be in an industry that I've seen it just in my career over 14 years, that we do talk about it. We have mental health is free to us. It is free to everybody that lives under my roof, whether they're related to me or not. We value taking care of our officers.
Thank you so much. Any questions from committee members? Senator Stone.
First of all, thank you both for your service and being here today. Are you aware of any specific calls where there was a psychotic episode that was related to psilocybin or any other hallucinogens?
Beth Schmidt for the record. Well, the Las Vegas Review-Journal is in the room, and they did publish a story recently. We had a very, very unfortunate event that occurred 2 weeks ago. And in that, a young man appeared at a Las Vegas hospital. He had a gunshot wound to his face, and by his own admission, he told medical personnel that he was high on shrooms, which is the street name for psilocybin. Tragically, our investigation revealed that this man who came into the hospital, he had shot and stabbed his friend. And today, that man is sitting in CCDC. He's accused of open murder. It is likely that recreational use of psilocybin played a role in this incredibly tragic crime. And let's not forget this. The fact is there are 2 families without their sons today.
Yeah.
So that's the most recent that I can tell you. That is incredibly tragic, and that worries us and concerns us.
Well, that's a worry for me as well, especially with youngsters that may not understand the powerfulness of some of these medications.
Jason Walker, we go to mental health calls for services all day long. Any that I could attribute specifically to psilocybin, no.
Okay, thank you.
Thank you so much. And, you know, I also want to make sure that we understand that if there are cases, as referenced to the article, we also see violent encounters with alcohol. But we understand through the studies that have been published over the encounters of years, the controlling of the narrative as to what is appropriate and what is not. So I think that's kind of the outcome of what the work would look for. So I appreciate you guys for coming forward, and we'll go ahead and go on to testimony at this time. So in the interest of time, I will cap. It's a pun. I guess people didn't get it. I will cap. Oh, thank you. I've been thinking about mushroom puns all day, so I will go ahead and cap public testimony in support, opposition, and neutral to 30 minutes each. We will, again, for the folks that are here present, we are going to set the timer in the interest of time. We have a lot of folks that want to participate. We encourage you not to use up to 2 minutes because we want as many people to participate, but we do have time limits, of course, because we can't drag out the meeting all day. So we'll go ahead and bring folks here. So we'll do 3 here, then we'll go to Las Vegas, and then we'll do some online. So we'll try to bounce from one to the other. So we'll start the timer now, so folks can come on in to the front in support. And please state your name for the record, and we'll begin the 2 minutes. We'll start from this side. Go for it.
Good afternoon, committee members. My name is Brian Lang. My lifetime works in medical and psychiatric quality improvement. Basically, how do we do a better job healing our communities? I've worked with over 400 health care organizations globally, from blue chip hospitals to Military Health, English National Health, and the Sultan of Brunei's Royal Hospital. This is my 15th year of working in psychedelic harm reduction and promising new psychotherapeutic compounds and therapies, as well as training development for law enforcement, mental health professionals, physicians, EMTs, and first responders, and consumers. I'm also the co-author of the mandated evaluation report for the Denver Psilocybin Decriminalization Initiative, which will play into this. Psilocybin has been used for over 9,000 years, tens of millions of uses. There are 3 confirmed deaths due to toxicity. FDA granted psilocybin breakthrough status. Safety toxicity issues have been cleared. It's expected to be approved at U.S. therapeutic use in 2024. Australia just legalized it for therapeutic use. 500 years ago, the Swiss physician Paracelsus said, "The dose makes the poison." Water can be lethal, hyponatremia. Over 500 deaths in the United States annually from acetaminophen. That's Tylenol. CDC reports over 140,000 alcohol-related deaths annually, with no FDA clinical trials assessing medical benefit clearly. Psilocybin, 22 study, 9,233 past year users, 19 sought emergency care, all but one returned to normal after 24 hours. 2010 UK Drug Harms Report rated some substances relative of harm of use to self and others. Psilocybin was rated 6 out of 100, tobacco 26, methamphetamine 33, heroin 55, and alcohol 72. That's 12 times the relative harm to self and others. Lethal dosage of psilocybin estimated at 22 pounds of fresh. That's 2.2 pounds dried. I charge anyone to try to eat 22.2 pounds of dried mushrooms. It would not go very well. Recreational use, it's interesting you brought up the point why we're seeing more people with dried mushrooms. Dried mushrooms are really easy to see whether they're contaminated or not. The only reports of contamination of mushrooms we've seen has been in capsules from the darknet. Chewing down mushrooms is an awful lot safer than any of the powdered substances.
Thank you so much, sir, for your comments. If you can submit your additional testimony to our committee staff.
Happy to do so.
Thank you so much. Please proceed.
Yes. My name is Greg Ray, G-R-E-G-R-E-A. I'm a board member of the Nevada Coalition for Psychedelic Medicine, speaking in favor of SB 242. I represent a rapidly growing community of very conservative people who have discovered ancient psychedelic substances as an incredibly powerful tool for mental health. I've been married to my college sweetheart for 4 decades with 3 grown sons and 2 grandchildren. In college, I played football, have been recognized as a part of the Nevada Wolfpack Hall of Fame. After my time in the university, I was a Reno police officer and served 12 of those years on the SWAT team. Upon the leave of force, I was then an evangelical Christian pastor. I've been a law-abiding conservative until the age of 56, when I tried psilocybin, and for the first time in a therapeutic, albeit illegal setting, which changed my life and freed me from a 7-day-a-week alcohol habit brought on by decades of hypervigilance and exposure to trauma stemming from my police service. Since then, I've made friends with many former first responders and military veterans who, through experience of the ceremonial use of these compounds with a professional guide, were able to experience healing. We have former police officers, firefighters, Navy SEALs, EOD techs, Marines, ER nurses, trauma surgeons, all who have seen and experienced an overwhelming amount of human suffering, which has devastating effects on their mental health and families. These compounds provide the miracle of psychological healing, and I have seen marriages saved, relationships restored, suicides prevented, and addictions healed. As warriors and sheepdogs, we took the oath to protect and serve others. We were trapped inside the hurt locker of pain and suffering experienced while carrying out our oath. We have the most to lose by breaking the law just to seek our healing. We simply know too much about the safety and benefits of these substances and now have an ethical and moral obligation to allow their use in a legal manner. I was a soldier on the war on drugs. Now I'm a soldier of healing. I don't care to be an outlaw, but I will do what I must do to bring this healing to my brothers and sisters of service. I appeal to you to pass this bill.
I'm sorry, that cannot happen. Let's make sure that we have order in this room. I understand that the testimonies that we'll have for in support and opposition and neutral can be passion driven, but that cannot happen. And we have security outside if that occurs again. Please proceed.
Thank you. Good afternoon. Rebecca Gasca for the record, REBECCA-GASCA. As a 10-year Nevada lobbyist, I've had the privilege of working on hundreds of bills relating to civil liberties, including criminal justice, drug policy reform, and plant-based health interventions, including medical cannabis and kratom. However, throughout my body of work, I never expected that I'd be in a place to testify in a personal capacity in such a meaningful way. On May 30th, 2020, I suffered severe trauma while serving as a volunteer ACLU legal observer during the George Floyd protests when I was unexpectedly shot 3 times by a Reno police officer with 40-millimeter compressed pepper bullets that exploded on impact on my body. That evening, I walked into an empty parking lot by myself, far away from any protesters, but close enough to law enforcement so that they could read my legal observer vest that clearly identified the capacity in which I was serving. After I raised my hands above my head to show that I was not a threat, I was first shot in my left arm. Standing in shock, I was shot a second time in my upper right thigh near my groin. I sat down on the pavement, overwhelmed, yet the officer continued to shoot at me with his pepper bullets exploding on the ground near my side. I stood up and was shot a third time and final time in my upper left thigh near my groin. I could do nothing but turn and walk away. The trauma I suffered from being shot by that police officer was extreme. The physical trauma resulted in massive bruising, and I still have scar tissue and adhesions in those 3 places where I was shot. However, those injuries are nothing compared to the lasting effects it had on my personal and professional life, considering that I've suffered from severe PTSD-related symptoms and the cognitive distresses from that incident. You didn't see me lobbying last legislative session because, frankly, the effects prevented me from running my firm, Pistol and Stigma, my government affairs and regulatory affairs firm at the time. Well, I've been fortunate enough to have amazing medical and mental health support, and though I tried many traditional psychological and psychiatric support interventions, including doctor-supervised IV ketamine delivery, nothing was helping me cope with the PTSD ongoing effects until I resorted to psilocybin. In my case, I'd never used any psychedelics in any recreational setting, like a party, at a festival, or with friends. But during many of my years of drug policy reform and related advocacy work, I simply followed the many years of clinical research and outcomes that have been spoken about today. That's why I chose to work with trained facilitators while underground who supported me while I consumed psilocybin. Microdosing psilocybin in amounts that are sub-perceptual, so no temporary.
Thank you so much, ma'am, for your comment. Unfortunately, we'll have to move on, but if you can submit it in testimony.
I will. Thank you.
We'd appreciate it. Please, we'll go to Las Vegas. Please proceed.
Good afternoon, Chair Doñate and Vice Chair Nguyen and members of the committee. For the record, my name is James Garvey, and I represent the Las Vegas Psychedelic Society as president and Decrim Nature Nevada as treasurer. I have a Master's of Arts in Psychedelic Spirituality and a Master's of Divinity, and I'm currently working on my PhD dissertation. I'm here to support SB 242. I was initially drawn to psilocybin to seek answers and heal my own spiritual and emotional distress, which began around age 6, when I was first hospitalized for attempted suicide. I then spent the rest of my childhood on a variety of medications and in and out of therapy until I ended up homeless while I was still in high school. At age 19, I was lucky enough to have the opportunity to experience the transformative powers of psilocybin, and my life changed forever. I have since worked with entheogenic plants and fungi, including psilocybin, for over a decade. During that time, I've experienced these substances from people from all walks of life, including but not limited to teachers, lawyers, law enforcement, veterans, doctors, artists, chefs, legislators, business persons, people on full disability, and many others. I cannot speak for their experiences, but I can say that all of them were called to seek out this substance, some for personal growth, some for healing, some for curiosity, and, in small cases, some for fun. Every day, more and more Nevadans seek out myself and people like me asking where they can access mushrooms. Some for curiosity, but the numbers are rapidly tilting to individuals who have tried every possible option the system offers. People are at the end of their rope, begging for answers, begging for a chance to not be in pain, to be depressed, suicidal. People contact me begging to help them to be able to live, begging me to allow them to hope. Currently in Nevada, hope is criminalized. The only legal option I can give them is to recommend them to travel to a place where these experiences are not prosecuted, where they have potentially spend more than their entire life savings for a chance at feeling normal again. I am tired of sending people to other countries to access something that can grow anywhere safely. They have been used by humans for thousands of years. A substance like this is safer than children's Tylenol, and I am working on continuing the education and awareness of what can be accomplished by enabling Nevadans to have access to mushrooms without fear of prosecution. Let us decriminalize hope. Thank you for your time, and I am available for questions, and I look forward to continuing this conversation.
Thank you so much. Let's go to the next person in Las Vegas.
First, thank you so much for opening the space for us. My name is Wendy C. Carrion. Within the community, I am known as Maestra Wendy. I'm a mother, a researcher, a medicine woman, a curator of life-altering experiences. How has psilocybin changed my life? By making peace with my past, including a volatile and abusive childhood and young adulthood, sexual trauma, including sodomy. I've endured a miscarriage. I've lost a domestic partner with suicide by cop. By the way, he was a veteran. Multiple hospitalizations, opioid dependency, as well as heroin abuse. That was my story. There's much more, but for another time. These beautiful and powerful allies have helped guide me to a very profound path to self-healing that continues teaching me how to be better to myself and others. They have helped me pave a road towards continuing my education as a mycologist as well as a business owner. They help guide with detecting disease, the root cause on myself as well as others. They currently help me manage my stress, including my child's most recent cancer diagnosis. These medicines have taught me and continue to teach me about love, compassion, establishing healthy boundaries, how to execute absolute transparency within myself, and how to express it with others. I speak on behalf of those too afraid to share, for those in pain and those in despair. I speak on behalf of the fungi. They are here to teach us how to coexist within ourselves and with each other. They lead the path to wholesomeness. I depart by asking the audience, how many people know someone who can benefit from these medicines? I thank you.
Thank you so much. We'll have one more person in Las Vegas, and then we'll go to virtual.
Good evening, everyone. My name is Melly Paluai. I am a Visayan Ilonggo immigrant inhabiting Nuwuvi, Southern Paiute ancestral lands. Thank you to the committee for hearing my testimony. It is an honor to speak with you all today in support of SB 242 and its decriminalization of psilocybin and study of MDMA. I believe this bill has the ability to bring a momentous change in the lives of Nevadans and their families for generations to come. With that said, I urge you to look at any further revisions to this bill with scrutiny. I withhold my support if revisions are made to this bill that may harm protection of peyote for Native Americans. Please follow the guidance of the Indigenous Peyote Conservation Institute and do not allow the decriminalization or study of peyote in Nevada. Peyote is a mescaline-containing cacti that has been gravely endangered and has been a historically protected sacrament for the Native American use. There are mescaline-containing cacti that are not endangered and do not take up to 10 years to grow a viable seed, such as Wachuma or San Pedro or the Peruvian cacti, Peruvian torch cacti. These are not a sacrament of the Native American Church. Again, please exclude peyote in any revisions made to this bill moving forward. As a combat veteran of the Afghani War, a registered nurse, and an ambassador of the Heroic Hearts program, I am aware of the decades of research that support psilocybin's effectiveness in helping treat many mental health ailments. Mental health can affect every aspect of a person, to include their physical, emotional, and spiritual selves, as well as their personal and professional relationships with others, their livelihood, their finances, and more. I currently work in a ketamine clinic, and ketamine, as you know, is an anesthetic with psychedelic properties. However, ketamine treatments are very expensive, which makes it inaccessible to the general public. Every day at work, I see patients from all walks of life undergo ketamine infusions and make strides to overcoming their major depressive disorder, treatment-resistant depression, PTSD, complex PTSD, anxiety, death anxiety, chronic pain, Alzheimer's, addiction, and substance abuse disorders. I support SB 242 because I want everyone to have safe access to the same profound healing that psychedelics like psilocybin can provide. I trust that you will take into consideration the research.
For your comment. We're going to have to move on to the next one, but if you could submit that in writing to our staff, we'd greatly appreciate it.
Yes,
BPS?
will do. Thank you so much.
Anyone virtually?
If you would like to testify in support of Senate Bill 242, please press star 9 or raise your hand in your Zoom window to take your place in the queue.
Hello, my name is John Jeffrey. For the record, thank you to the Senate Health and Human Services Committee, to Senator Wynn, and the many people who have worked to bring SB 242 before the committee. I'm here to speak in favor of it. I am a chemist, a researcher with a degree in physiology and food chemistry, and someone who experienced extreme trauma in childhood in Chicago, where I grew up. I was exposed to addiction, struggled with alcohol and drug abuse as a young man, witnessed the deaths of many of my loved ones to these struggles, and myself have dealt with depression and suicidal thoughts. Neither therapeutic treatment nor pharmaceutical drugs were able to give me relief from the trauma of these experiences, but psilocybin mushrooms and only 4 personally administered treatments in my early 20s and experiences later with indigenous healers outside of this country have largely relieved me of these burdens and allowed me to experience a sense of hope I did not believe was possible. I've also been witness to transformations in military veterans, first responders, and many others who have suffered trauma and experienced relief through the use of psilocybin mushrooms. I'm urging support for SB 242 as a personal freedom matter to the citizens of Nevada, and to recognize the scientific evidence that has shown their relative safety as healing medicines. I would also second the desire expressed previously to absolutely exclude peyote from this bill due to its increasingly endangered status and the sacred nature of its relationship, that it has to Native American tribal religions. Thank you very much.
Distinguished members of the committee, my name is Diane Goldstein, and I served for 21 years as a police officer. I'm also the executive director of the Law Enforcement Action Partnership and a constituent. We are a nonprofit group of professionals who speak from firsthand experience. Our mission is to make communities safer by focusing police resources on the greatest threats to public safety and working towards healing police-community relations. Policing professionals in the United States have recognized that we can no longer rely on arrest as a means to address a public health issue. Saving lives and reducing the crime and disorder caused by underlying problematic drug use are not mutually exclusive. A response that can achieve both ends requires a paradigm shift towards evidence-based practices that closely link public health and enforcement strategies with their most important outcomes, which is saving lives. In our work, we see how destructive, outdated drug laws can be to individuals and communities. Decriminalizing the possession and personal use of plant-based psychedelics will allow the police to prioritize serious threats to public safety and redirect resources to strategies that work rather than requiring a disproportionate criminal response. A 2017 study reflects that lifetime psychedelic use was associated with a reduction of odds in committing past year criminal acts, including property and violent crime. Plant-based psychedelic use is so low that even in the annual DEA drug threat assessment, they historically have never been mentioned as a public safety concern. Notably, the DEA is only reporting synthetic new psychoactive substances and does not list any of the substances that would be decriminalized in this bill. In a time of rampant opioid overdoses, police and veteran suicides caused by PTSD, an unaddressed mental health crisis in this country, no one should go to jail for using a healing psychedelic to treat mental health issues. I urge this committee to move this legislation forward. We are in support of SB 242. Thank you for your time.
Thank you so much. One more virtually, and then we'll come back to Carson City.
Hello.
Please proceed.
Hi, my name is Jaden Ray. I am the author of the Microdosing Guide and Journal, and I also write 2 columns for the Vegas Cannabis Magazine and the Tahoe Cannabis Magazine, both on psychedelics, and most importantly, I microdose on magic mushrooms. Every day, I'm engaging in an activity that is illegal, punishable for up to 10 years in jail and $50,000 in fines. I do this because my actions have saved my life, and I too believe in healing loudly. Throughout my life, I suffered from postpartum depression, anxiety, and alcoholism. Doctors prescribed me a cocktail of pharmaceuticals from Lexapro, Paxil, Zoloft, Celexa, Naltrexone, Cymbalta, Effexor, and Prozac. And guess what ones worked for me? None of them. The side effects of these pills were worse than the depression. I was suicidal, leaned more on alcohol to numb the pain, and I was a walking zombie. And it turns out I wasn't alone. While 1 in 10 Americans turn to SSRIs to manage anxiety and depression, more than half of them battle addiction to the very same medication that's supposed to be helping them. But a recent Johns Hopkins study found that psilocybin treatment was 4 times more effective than traditional meds for treating depression. I don't use psilocybin to get high. A tiny subperceptual dose, just 1/10 of a dose, is life-changing. This tiny mushroom, smaller than a teeny tiny safety pin, is my daily dose. It's 1 ingredient. It's not a manufactured chemical. It's 1 ingredient from Mother Nature. I'm no longer on any prescription medications, which means all of the side effects of those medications have disappeared. And after 27 years of being an alcoholic, I've completely quit thanks to microdosing psilocybin. My path is so clear, it's like a fog has been lifted and I am no longer weighed down. Despite the legal ramifications, I lead a weekly Zoom called Microdosing Mondays to provide a safe place for people to learn about psilocybin. We focus much of our conversations about safety and dosage. I do this because there is a lot of misinformation on the internet, and you're right, there are dangerous mushrooms. But because psilocybin is legal, we have to rely on the internet. But who do you trust with your life? At Michael Mushy on Instagram or a faceless shaman on Discord? With SB 242, Nevadans can have open, honest,
Thank you
and
so
safe
much, ma'am,
conversations
for your comment.
trained
We're going to have to
Thank
move
you.
on to the next one, but if you can submit your testimony in writing, that'd be great. We have time for
Will do. Thank you.
we have time for 3 more in Carson City, so we'll start with you in the middle.
Thank you, Senator. John Pirro from the Clark County Public Defender's Office. Our nexus to this is, as all of you senators know, we're last place here in our state in mental health. Our suicide rates are terrible. This is a way, and a cheap way, that we can actually help people. And we can help people in the rurals where practitioners aren't going. So Dr. Titus doesn't have to be the only one out there helping folks all alone. This is actually a very common sense way to move our state forward and put us actually on the cutting edge of something where Nevada's not necessarily on the cutting edge. I am grateful for Senator Nguyen for bringing this forward, and I strongly urge your support. Thank you.
Good afternoon, Chair Doñate, members of the committee. My name is Kate Cotter. I am president of Sierra Psychedelic Society and a co-founder of Nevada Coalition for Psychedelic Medicines. I'd like to offer a personal testimony in support of SB 242, as it's the reason I have dedicated my life to bringing awareness and education to psychedelic medicines. I suffered from a severe lifelong treatment-resistant anxiety disorder, punctuated by deep bouts of depression, both of which culminated in a very serious alcohol addiction that I battled for years. Microdosing psilocybin accomplished in a matter of weeks what decades of therapy and medication had not been able to touch with the anxiety and the depression. Macrodosing psilocybin with the stated intention of addressing the substance use was the key to my recovery. It was not a magic bullet. It required a great deal of personal work, but I am happier and healthier than I've ever been in my life, and I owe my life to this medicine. These compounds are remarkable, and we have an extraordinary opportunity to bring healing to countless lives. We've also been conditioned for over 50 years to associate this natural remedy with some very dangerous substances on the Schedule I list. Many in this room have devoted their careers to fighting a war on drugs to keep our communities safe. So this is understandably a polarizing issue for some. For those of you that remain skeptical or opposed, I would humbly ask that you consider the decades of research that show the medical value, the anti-addictive properties of psilocybin, and the glowing safety profile. We need to stop prosecuting people for seeking healing. SB 242 has the potential to save lives, and I urge you to support this bill. Thank you to Senators Nguyen and Doñate for introducing this legislation and for your time and attention.
Thank you so much. To the gentleman that was waiting, we can keep going, so go for it.
Thank you, Senator Nguyen and Senator Doñate and the Health and Human Services Committee for this time and this space for us to share of the benefits of SB 242. I began my journey with psychedelic medicines after my husband, a Marine Corps veteran, chose to exit his Earth experience through the completion of suicide on St. Patrick's Day in 2016. From that experience, I have received full initiation rites as a shamanic journey guide, and I'm a full Mesa carrier, and have witnessed the healing benefits for many veterans within our communities and other states within Nevada. I personally have gained remarkable healing experiences, profound clarity, and a sense of connection to a life experience that had become so dull. And should we not choose to move forward with SB 242, then we are doing a disservice to the lives of every human who is navigating profound trauma, immense grief, and PTSD, specifically with our veterans and first responders. We are deeply grateful for the experience to be able to speak of this and the safety that's been created for us to do so. We honor what it is to uphold the legal aspects of our nation, and also to the conversations that have been taking place, the shifts are more than necessary. Because to the statistics of 22 veterans a day that are choosing to complete suicide, and the families that are left to navigate that pain, there is a medicine from the earth that is here to nurture us from the original mother, and that is not lost on any of us. Should one person choose life because of these medicines, then it is absolutely worth it. And thank you so much for your time and consideration. And I am honestly very surprised at the way that this has been received today, and it is very, I'm filled with an epic amount of hope.
And your name for the record, please.
Oh, Blair Zika.
Thank you so much. Please proceed.
Hello, my name is Justin Watkins. Please forgive me, I'm morbidly out of my element. Just want to say thank you for proposing this bill. It means a lot to me, my family. I live with anxiety and depression. My family suffers from it, and I'm here today to voice the advocacy of the passing of this bill so that way I can get the mental health treatment they deserve. I'm a struggling alcoholic, and after this, I will go get a drink. It's really the only avenue I've found of peace. And I've done about 350 hours of research on the therapeutic benefits of psilocybe cubensis and psilocybin-containing mushrooms, and I just think we're a little behind on it, you know? And I support this bill. Thank you.
Thank you so much. We have time for a few more, actually. So we'll go to Las Vegas.
Good evening. My name is Shane Terry, and I'm here to support SB 242. I'm a service-disabled vet with 14 years of active service and 3 combat deployments. My last assignment was at Nellis Air Force Base, and I left the military to participate in the launch of Nevada's medical marijuana program in 2014. Although I'm here now in my individual capacity, since then I've been honored to serve as the former president of the Nevada Cannabis Association and currently the Governor's Cannabis Advisory Commission. I've seen firsthand the beneficial effects that cannabis legislation has had on our community, how that legislation has allowed patients to finally use a plant as medicine, and the benefits of other natural medicines such as mushrooms for veterans suffering from physical and emotional traumas. It was only a decade ago when a veteran's options were limited to opiates and other pharmaceutical treatments that often left vets as a shadow of their former selves, now fighting a battle of depression. That directly contributes to this statistic that 22 vets a day lose their lives to suicide. But as beneficial as cannabis has been for the treatment of PTSD and other trauma, for my personal experience, cannabis holds a fraction of the healing powers that I personally found with psilocybin and other entheogenic plant medicines. I've seen firsthand vets find transformational healing from just one experience with psilocybin. For anyone that has had a therapeutic experience with psilocybin, you'll empathize with the humbling moment I remember spending hours in tears in my living room hugging a former team lead of SEAL Team 6 while he processed more trauma in a night than he had released in 10 years. Imagine the work that could have been done if we had the opportunity to do that under the care of a licensed clinician. The truth is that the word about plant medicines is out. Veterans and other people are knowingly putting themselves at criminal risk that could destroy their careers to seek the treatment they need. We need to recognize the benefits, stop ruining lives, and start saving lives by decriminalizing the possession of a substance that is far less harmful than alcohol. Thank you.
Thank you so much. And we've reached to our last one in Las Vegas.
Thank you, sir. My name is Francis Trezza. I am a certified ethical hacker and member of the information security community. I'm here just representing myself today. I have never had the opportunity to do psilocybin, but I have heard of the transformative healing powers of it. And it's a natural psychedelic compound, and I believe that it should be legal here. And I would like to one day try it under a therapeutic environment. Nevada has had the opportunity to take a bold step forward in the field of mental health by decriminalizing psilocybin, and by doing so, the state would open the door to a wide range of potential benefits for both individuals seeking treatment and society as a whole. I know there's a lot of fear surrounding legalization and decriminalization of drugs, and as somebody who lived in Portland, Oregon for over a year, I have seen the negative effects of decriminalization on the population there. I do feel, however, that psilocybin seems to be very different than the other drugs that are associated with this. And research from reputable universities such as Johns Hopkins and NYU has shown that psilocybin can be an effective treatment for depression and anxiety, and it's being studied for other issues such as PTSD, traumatic brain injury, and addiction. I think that decriminalization would benefit society by reducing the burden on the criminal justice system, as well as benefiting the Nevada economy by becoming an early adopter of psilocybin decriminalization. You could position yourselves as leaders in a growing field, attracting new businesses and investment. In conclusion, decriminalization would provide numerous benefits to individuals and society as a whole, and access to a safe and a treatment option for people like me who suffered from mental health issues for most of our lives. Thank you very much.
Thank you
That's
so
my
much,
time.
sir. Appreciate it. That concludes our support testimony, so we'll ask folks to step back from the dais so that way we can have and move on to opposition. So at this time, we invite folks who have testimony in opposition to this bill. And the same from Las Vegas, so if any folks want to step forward for opposition. Let's make sure that the mic is off, please. In Las Vegas.
Our microphones are off here.
All right, we'll go ahead and start the clock. Sergeant Schmidt, please proceed.
Chair Donate and members of Senate Health and Human Services Committee, I'm Director Beth Schmidt from the Las Vegas Metropolitan Police Department. We oppose SB 242 as written because this is a decriminalization bill. Psilocybin is a Schedule I controlled substance and it is prohibited at the federal level. And decriminalization of psilocybin is a threat to public safety. Decriminalization aside, we don't disagree that making psilocybin medically available is perhaps a next step. We acknowledge that addressing mental health is a priority for this state and for our citizens. But psilocybin is a naturally occurring fungal product, and because of this, it presents unique challenges in regards to conducting studies, efficacy assessments, and quality controls. Clinical research is being conducted on psilocybin in other states, and we've talked about that today. And knowing that research is underway elsewhere, the question that we ask is Nevada adequately informed and prepared to be the next step to study psilocybin? Because there are concerns about how to conduct research on a federally prohibited substance in Nevada, we support Senator Wynn's concept of creating a working group, and we ask that law enforcement be given consideration to be included. We acknowledge psilocybin research is a complex issue. We are opposed to SB 242 as written, but we look forward to continuing to work with Senator Wynn on this important issue.
Good evening, Senator Jason Walker. Good evening, committee members, Washington County Sheriff's Office. Testifying in opposition to Senate Bill 242. I echo the comments of my colleague, and I understand and agree with enabling research to produce treatments for mental health. The concern that I have is I prefer that it be used in a controlled environment. Previous testimony that was provided, past bills mentioned supervised study and research, supervised access. It is my opinion that potentially it should be supervised usage. I agree with the public safety concerns, most importantly, impaired driving on the highways. A 2021 study showed that 384 total fatalities, 224 of those, or 58.33%, were a polysubstance use. It is my understanding that psilocybin could stay in your system for up to 24 hours, depending on the dosage and the physical makeup of the person. I am certainly willing to continue to work with Senator Wynn to possibly improve our position.
Thank you, Chair, members of the committee. For the record, Mike Cathcart, representing the City of Henderson. We are opposed to the bill as amended, but we are supportive of the research components of this effort, and we liked the research components of the original bill, as well as if we need to do a working group that's in the amendment as well. And we're hopeful that through those efforts that there are breakthroughs in the areas of depression, anxiety, PTSD. However, the city is in opposition to Section 4 of the amendment that appears to decriminalize up to 6 ounces for anyone over 21. We believe this is a big step and may have severe unintended consequences to our community, and we'd like to see more research and discussion on what those impacts really are to our community. And I would just agree with what Senator Stone had said. I believe we're kind of in the same lane that he was talking about. We'd like to see more research, more supervision around this substance, and but we are opposed as it is written now.
Thank you so much, sir. One comment before we continue forward. If there are folks in the overflow room that are in opposition that would like to testify, now would be the time to make your way over. Ms. Case.
Thank you, Chair Dunyate and members of the committee. Leah Case here at the table, this time on behalf of the Nevada Psychiatric Association. Our members have been discussing this bill since it was released. With the amendment, we still have concerns. We appreciate that the bill sponsor has moved the age from 18 to 21, but the brain is still not done developing until about 25 or 26. So that is one concern. And ideally, as mentioned in a previous comment, we would prefer to see use under clinical supervision, not necessarily just at home in your living room. And then regarding the work group in Section 3, there are just a few concerns about the makeup of the work group, but specifically Section 3, subsection 2C, there are 2 small I's, so this would be the second small I. One member who is currently licensed to practice medicine, psychology, or psychiatry within the state. The Nevada Psychiatric Association has a preference there to be one member who is a psychiatrist licensed to practice medicine in the state of Nevada. More specifically, someone in addiction medicine would be preferred. So those are our concerns in a nutshell, and I will turn it over to Dr. Erica Rist here, and we'll follow up with the sponsor for more specific amendments. Thank you.
Hello, good afternoon. Thanks for hearing my testimony. My name is Dr. Erica Rist. For the record, that's spelled E-R-I-K-A-R-Y-S-T, M.D. I'm a medical doctor. I'm double board certified in general psychiatry and child and adolescent psychiatry. And I've practiced child psychiatry in Nevada for up to almost 20 years now. I really appreciate this bill and the opportunity for discussion around this topic. I've learned a tremendous amount today and really appreciate all of the genuine testimony. I do feel as a child psychiatrist that I need to express some concerns, particularly with regards to how this bill in its current state could affect our young people. We do have a large body of research that indicates that hallucinogens are harmful to the developing brain up to the age of 25 years and can predispose to long-term psychotic mental illness like schizophrenia. And secondly, that teenage substance use is driven by the perception of safety and low risk, which is in turn driven by legalization. And by decriminalizing these substances, we are in effect telling our young people that these substances are safe, and they're going to believe us on that, and we will see an increase in use of these substances, which unfortunately, although there is some research, it's not quite as glowing as I believe has been presented today. Really, the research, although promising and very interesting and exciting, is in its infancy, and we have very little to know about the safety of psilocybin. I do have an editorial from the New England Journal of Medicine. It's 2 pages by a Harvard Medical School full professor about some of the concerns around the existing research, and that in fact there are a lot of methodological problems with the existing research. We actually do not know if it's safe, particularly for people whose brains are still developing. And so for that reason, I would really ask that we put more thought into the bill as it currently is. Thank you.
Thank you so much. Anyone else in opposition? Anyone in Las Vegas? Anyone virtually?
If you would like to testify in opposition to SB 242, please press star 9 or raise hand within Zoom to take your place in the queue.
Good evening, Mr. Chair and members of the committee. This is Jennifer Noble on behalf of the Nevada District Attorneys Association. We do oppose this legislation as written. These substances may indeed have therapeutic value for persons experiencing PTSD, medication-resistant depression, anxiety, and a variety of psychiatric and mental health disorders. And we recognize that there are Nevadans that suffer terribly with these challenges, but the therapeutic use of these drugs should be limited to a safe, controlled medical setting and under a doctor's supervision, just as Nevadans have to do with FDA-approved medications for mental health that require a prescription from a physician. And although the presentation has referenced safety and bills authorizing studies in Oregon and Texas have been passed, the accepted amendment makes clear that there are no safeguards here. Having reviewed it, it doesn't reflect an attempt simply to facilitate research or studies. It doesn't limit to use in a person's home. This is do-it-yourself. This is the legalization of psilocybin and MDMA, and the physical effects of these drugs are vary, and they can include hallucinations and sensory experiences that don't exist outside a person's mind, and delusions, and even terror in some instances. In particular, MDMA is a psychedelic amphetamine, and in addition to distortions in time and perceptions, it has a stimulant effect. And in these effects, according to NHTSA, last 1 to 3 hours. So broad legalization of these substances with no studies, no controls, and no safeguards would be a mistake and a threat to public safety on our roads and in public and private settings. We do look forward to continuing to work with Senator Nguyen on this legislation, and we appreciate your time. Thank you.
Good evening, Chair Donate, members of the committee. My name is Greg Herrera, Herrera, VAR and our partners, and tonight I'm representing Nevada Sheriffs and Chiefs Association. The testimony I've heard today has been extremely compelling, including that of a former SWAT regional colleague of Greg Ray. However, I'm here in opposition of this bill in particular. And out of respect for your request at the beginning, Chair, our concerns remain in line with that previously relayed by Director Schmidt and Sergeant Walker, Las Vegas Metro Police Department, Walsh County Sheriff's Office, and that of also Jenny Noble of the District Attorneys. Thank you.
Chair, there are no additional callers choosing to testify at this time.
Thank you so much. Last call for anyone in opposition. Okay, we'll move on to neutral testimony. Is there anyone in this room that would like to provide neutral testimony at this time? Anyone in Las Vegas? I see, like, there's a couple of them. Please proceed.
Hello, this is Cindy Brown. I represent Coalition for Patients' Rights. We also helped change the laws here in Nevada to allow for dispensaries some years ago. We are neutral because we see a few holes in this, the way that it is written. They didn't do a really good job with the patients, and they're still stamping out the patients right now. And so we'd like to see some of those things fixed. One of your guys' concern was about the safety of cannabis. Today at the Las Vegas Medical Marijuana Association meeting, I talked to Tyree of Canalysis Labs. He told me that Dr. Tong of G6 Labs is more than willing to help write the guidelines for testing. And they also wanted to make you guys aware that the cannabis labs can test the psilocybin without having to build new labs, spending millions more of dollars. And Dr. Tong's phone number is 702-245-0834. That's 702-245-0834. In general, we do like the bill, but we do see holes. Thank you, guys.
Thank you so much. Please proceed.
Hello, my name is Julie Montero, Monteir. I have been a proud Nevada resident since 1997, a UNLV graduate and a licensed registered nurse and PZR trauma nurse, and a non-paid lobbyist for the Compassion Center and their Center for Incubation and Findings Research, CIPHER, and I am the health liaison for the Coalition of Patient Rights. Some of you may know me as Ask Nurse Julesy, who spent over a decade dedicating a voice for patient rights on medical cannabis. And yes, cannabis is a gateway drug to health and wellness. And this psilocybin is only the second plant-based medicine that the people have introduced into legislation. There will be and are more plants, so as a medical professional, I ask, how do we keep the public safe and educated as we move forward? In looking at your bill, I've noticed that I would like to see on the sections for research to be expanded to add ADHD, autism spectrum, and categorically complex disease states. In addition, when you guys talk about the department shall, and if you look at line 28, it talks about the department will actually be approving these studies. We as organizations want to know who and what board will be approving, how will the board be chosen, what's the rubric that will be utilized, and how does one appeal without lawsuits against the state? Because I know in the cannabis industry, boards were developed to said, hey, we're going to have a board, but then there were no guidelines or rubric for that, and it caused a lot of legislation and judicial issues that are still being held up today. So as organizations, we, as a solution, we suggest establishing a plant-based medicine board. And if you consider this, we're talking about cannabis, hemp, and I'm meaning only the medical side. I'm here viewing as a medical professional. Recreation's a totally different, and I support the Las Vegas Metro Police Department for saying that too. Recreational is completely different from medicine, and we need to go back to the medicinal route. Kratom, ibogaine, psilocybin, MDMA, DMT, ketamine, and ayahuasca. These are all substances, plant-based medicines that everyone has proven are.
Thank you so much, ma'am, for your comment. If you can submit your comments.
And thank you very much. And we are here for anything. We'd love to be part of that workshop. So please do reach out to us. I did leave our data and information. And thank you for being here so late tonight.
Thank you so much. We'll go to one last one in Las Vegas, and then we'll come back over here.
Thank you so much. I really appreciate that. My name is Catrice Saunders, for the record. I'm a longtime patient advocate and mother, also have veterans in my family, and my son serves in the United States Air Force in Las Vegas, Nevada. I am also in the business of healing out loud. I've been affected by the drug war at a state level and a federal level in the state of Nevada, helping patients have safe access to medical access in the state of Nevada at a state level and federal level. I was affected by DEA agents getting set up, posing as undercover patients while helping patients get legal in 2010. After going to prison and protecting patients, I was excluded after helping laws get passed after Vote 2. They exclude patients that have federal convictions from working in the cannabis industry. Psilocybin has helped with my PTSD, and I'm 10 years free from opiates due to psilocybin treatment. I also am passionate about veterans' rights because my brother-in-law died by suicide being a veteran. So I feel like having safe access to this medicine and treatment for people who are suffering from mental health illnesses is very important. I'm neutral because there should be more studies for medicine related to peyote that should be sacred and separate from the psilocybin bill. And just moving forward, I would appreciate you guys looking into this so it could be more beneficial for the residents of the state of Nevada. Thank you for your time today.
Thank you so much. Before we go to Carson City, again, for any folks in the overflow room, now would be the time to come over to this room if you want to testify neutral. Please proceed.
9 years ago, I attempted suicide by means of overdosing. At the age of 14, I was hospitalized for my attempt and diagnosed with major depressive disorder, generalized anxiety, agoraphobia, and ADHD. At this time, I was put on various antidepressants, including SSRIs, MAOIs, and mood stabilizers, all of which caused me to experience horrific adverse reactions and side effects. At age 16, I developed Stevens-Johnson syndrome as a side effect of the mood stabilizer Lamictal, in which I broke out in lesions all over my body. I still have lasting scarring from this condition. At this point, I was placed in numerous studies for adolescents with medication-resistant depression, all of which were unsuccessful at treating my deep sadness, and I continued experiencing intense suicidal ideation throughout my teenage years. By the time I turned 20, I knew something needed to change. I felt the need to try a natural healing modality. I had been introduced to microdosing a natural compound, psilocybin. By taking a non-psychoactive amount of this medicine, for the first time in my life, I experienced dramatic relief in my depression, suicidal ideation, and anxiety. It was able to heal my disordered mental health in a way pharmaceuticals weren't addressing. I am proud to say that today I am thriving. I no longer experience life-ending thoughts. I am a productive member of society, and I work to advocate and support for those who are suffering with suicidality. Natural medicine remedies are the reason I can be here today. I have family members on both sides who have completed suicide. They were never able to find healing. I stand here today for those who don't have access to natural healing modalities. I don't endorse the use of psilocybin, but I think that there needs to be access to more natural treatment methods.
And is that testimony in neutral?
Yes.
Okay, thank you. So, your name for the record, please.
My name is Taylor Atkins for the record.
Thank you so much.
Thank you.
Anyone else in neutral? Let's go virtually.
If you would like to testify in neutral for SB 242, please press star 9 or raise hand within Zoom to take your place in the queue.
Hello, my name is Bod Pisa. I'm a native here in Las Vegas, born and raised. I am someone who has used cannabis and psychedelic substances since I was about 5 years old. I've been getting arrested and called a terrorist and labeled as a terrorist by our justice system, someone who has spent basically my whole life in solitaire. At 18, I'm not saying that I'm a good person. I'm not saying that I'm a bad person, but at the end of the day, these substances not only helped save my sister from cancer, but these substances have also helped me cope with the assault that I would call on minorities or on people with different ethnicities, different thought processes, different cultures that just are outside of your guys'
Sir,
understanding.
is this a testimony in neutral?
Well, I was more or less wanting it to be in favor of it, but because I am a cannabis patient and I do understand that there are some cultural problems with it already, I think it would be better to be in neutral. But I am in support.
Thank you so much. We'll make sure to list you as neutral. Anyone else virtually that would like to testify in neutral for this bill?
Greetings. Thank you, Health and Human Services Committee and Senators Donate and Nguyen for this bill. My name is James Creel. I'm a registered lobbyist for Compassion Center and the Center for Incubation and Findings Research. We are in a neutral position currently as the bill is written. We feel that it needs to expand upon the parameters on which it is governing and issuing the licenses, as well as expanding upon the conditions in which it's researched for. We echo the statements about setting up actual research for it and making sure that it's done under the supervision of medical professionals. And with that, thank you for your time. James Creel, Compassion Center.
Thank you so much. BPS, anyone else virtually for neutral?
Chair, there are no additional callers choosing to testify at this time.
All right. Before we go to closing comments, I recognize there are folks that didn't get to testify. So if you are in support, if you could please rise. Thank you so much. Let's sit down. Opposition, if you didn't already get to testify. And neutral. Okay. Senator Nguyen.
Thank you. Rochelle Nguyen, Senate District 3. I'm incredibly moved by the outpouring of support and the people that chose, as Assemblyman Carter said today, to heal loudly. That's what this bill allows Nevadans to do, and I would encourage your support of Senate Bill 242.
Thank you so much, Senator Nguyen. And of course, to all those that came in person on either side, it's incredibly heartwarming to see folks engage in the political process. And for many of you, this was the first time. And so we thank you for joining us tonight. And I'll go ahead and close the hearing for this bill. We have reached the last item on the agenda. It is public comment. Again, we'll limit it to 2 minutes each. This is not the time to talk about any of the bills that we have already discussed. So is there anyone in Carson City that would like to provide public comment? Anyone in Las Vegas? And anyone virtually?
If you would like to provide public comment, please press star 9 or raise your hand in the Zoom window to take your place in the queue.
Good afternoon. For the record, my name is Bree Padilla, Bripadilla, and I serve as the Executive Director for the Chamber of Cannabis, Nevada's largest 501c6 professional trade organization for the cannabis industry. I'm here as a representative today, not only for our organization, but also a witness to the power of plant medicine. Our nation's mental health crisis is worse than ever, and psychedelics have shown great promise in treating these mental health issues, everything from PTSD to anxiety and depression. Let's keep improving the standard that we set for decriminalization and the legalization of plant-based solutions with the kind of therapeutic benefits proposed by the passing of SB 242. I look forward and am super inspired by all of the dialogue that we heard today, and look forward to working with the bill sponsors and our stakeholders to make sure that this important legislation gets passed. Thank you so much for your time today.
Thank you so much. And just a reminder, we have passed the time for Senate Bill 242. So anyone else in public comment virtually?
Chair, the lines are open and working, but there are no callers choosing to provide public comment at this time.
Thank you so much. That concludes our meeting for today, and our next one will be on Tuesday, March 28th. Meeting is adjourned.